A very good morning and a warm welcome to all our distinguished guests, esteemed editors, authors, panelists, and dear friends. On behalf of the Bharti Institute of Public Policy at the Indian School of Business, I, Nimisha Jain, Research Manager, have the privilege of guiding you through today's proceedings. We are gathered here to mark a significant scholarly milestone, the launch of the 6 volumes of Micro Studies in Human Development. This collection represents a major contribution to the Bharti Institute's ongoing efforts to bring practitioner-led, experience-rich, and academically rigorous public policy knowledge into the public domain. These volumes form part of the Bharti Institute's flagship book series with Routledge Publications titled Innovations, Practice, and the Future of Public Policy in India. The volumes have been developed under the initiative Platform for Development Research and Communication, supported by the Gates Foundation. Ladies and gentlemen, to formally commence the event, I kindly invite our esteemed dignitaries for the lighting of the lamp. Please join me in welcoming the esteemed editors of the Bharti Institute's flagship series. Please welcome Professor Anjal Prakash, Clinical Associate Professor, Research and Research Director, Bharti Institute of Public Policy, Indian School of Business. Please welcome Dr. Arushi Jain, Policy Director and Head, Government Affairs, Bharti Institute of Public Policy, Indian School of Business. I invite the series editors of these 6 volumes and the guiding light and anchor of this initiative, Mr. Amarjeet Sinha. I am also pleased to invite esteemed members of the Advisory Council of Bharti Institute of Public Policy, Mr. A.K. Shivakumar and Ms. Vrinda Saroop, to please join us on the stage for the lighting of the lamp. Thank you, everyone. Bharti Institute's flagship series with Routledge, titled Innovations, Practice, and the Future of Public Policy in India, is built on a simple but powerful idea that grounded experiential knowledge from the field, when combined with rigorous, peer-reviewed scholarship, can significantly reshape how we learn, teach, and practice public policy in India. I'm delighted to share that 3 volumes, The Last Mile, Technology, Policy and Inclusion, and The Lakhpati Kisan, have already been published under this series. The 6 volumes we launched today expand this body of work, both in scale and thematic breadth. I'm also delighted to highlight that all volumes in this series are published as open access with Routledge, ensuring free global access. To offer a brief overview, we will now play a short video message from the series editors of the 6 volumes. May I request the technical team to kindly play the video?
At the heart of every society lies the question of how institutions shape the possibilities of development. These are the structures through which citizens for social development in India is a recent volume under the Public Policy book series of the Indian School of Business with Routledge.
I am delighted to introduce you to 6 volumes that cover different aspects of human development. I want to start with 2 steps back from that. The first is that the Bharti Institute of Public Policy has a book series, and these 6 volumes are part of that larger book series. The book series is committed to bringing practical knowledge and written by practitioners, but put through a rigorous academic peer review process to be made available for teaching, for the edification of public policy enthusiasts, whether they are students, practitioners, or researchers.
It has been a delight as it brought together 194 practitioners, academics, policy makers, activists, civil society professionals together to share their experiential learning on education, on health, nutrition, livelihoods in rural areas, climate action, and challenges of institutional development.
This book actually entails grassroots level case studies from different regions of India and trying to show how adaptation can be done at a smaller scale and what are the potential it has for extrapolating at a larger scale. This book focuses on both climate action and justice. We are looking at it from the justice perspective. What is justice perspective? We are trying to see that the disproportionate impact of climate change, which is on the marginalized people, women, men, people from Dalit communities, that should be taken care when we are planning at a larger scale.
This book talks about institutions and how the current institutions can be reimagined, relooked at, and revamped in the times to come. Institutions have been the essence of every society. The people trust the state or the government just because of these institutions that are existing at different levels.
We have sort of more than a dozen sustainable development goals. Right? And well, we are also now more or less in agreement that we are not going to be able to meet the deadline of 2030 to meet any sustainable development goal, even one.
Can we have a huge round of applause for the series editors? It's because of their mentorship and constant guidance that we are here today to launch these 6 volumes. With that overview, it is now my pleasure to invite Professor Anjal Prakash, Clinical Associate Professor, Research and Research Director at Bharti Institute of Public Policy, Indian School of Business, to deliver the opening remarks. Professor Anjal, everyone.
Thanks, Nimisha, and very good morning to all of you. And nice to see the book, all the books are actually in our hands now, and the counter, you'll also find some of them being sold there. But let me just start this program with a little bit of background. So this is with a great pride and the sense of profound accomplishment that I stand before you today, and we gather the Mark II for a very remarkable milestone in the field of public policy and human development. We are here to celebrate the launch of 6 comprehensive volumes of micro studies on human development. This initiative reflects not just years of hard work, but the culmination of the dreams shared by so many individuals, passionate people, activists, and they are actually dedicated to the welfare of society. I must mention here 2 names, Amarjit Sinha, who has actually came up with the idea, and Ashwini Chhatre, who is unfortunately not present here today. But both of them actually started, and when we started this entire thinking of the volume, I actually thought it's a huge task to be done in a very short manner. But here we are 2 years down the line. We are with all the 6 volumes. I'm very happy that this is something which has come our way. And the volumes actually, as you know, is focusing on education, health, nutrition, climate action, and institutional challenges, and also livelihood and skill areas, right? So each volume serves as a crucial part for ongoing service series, which is entitled Innovation, Practice, and Future of Public Policy in India. Within these 3 pages, you will actually find the invaluable distillation of the experimental learning, meticulously subjected to thorough academic scrutiny that we see. So first and foremost, I would like to extend our warm gratitude to the 192 authors who contribute to about 102 chapters in these volumes. They are academics, they are civil society professionals, activists, policymakers, and practitioners who have actually poured in their expertise and experience dedicated to this work for long, long years. And this is something that we're really, really happy about. Their collective focus has not been on the capturing of transformative processes at play, but also their respective fields that has been in. And this collaboration actually has provided us with micro insights into the remarkable contribution, weaving together stories of innovations and resilience. And as you can see or go through each of the volume, you'll find that there has been huge documentation of the experiments that has happened at a very grassroots level, and each deserving our recognitions as volume editors. Also, tireless dedication and unwavering commitment to excellence has been pivotal in this endeavor. We also would like to call out all the RAs who have been part of this process, and the way in which we have joined them together, because these are people, perspective academicians, or people who are going to work in the academic area, and they have helped each of the volumes to come about. Lastly, I would also go into the area and see whether we have the sincere hope that these volumes actually serve as a source of inspiration and practical tool for the change. It also focuses on the imaginations of many, many experiments that happens at the grassroots level, which actually goes undocumented, and that's something which I'm really happy about. As part of Bharti Institute of Public Policy, I congratulate all the editors, first of all, and all the authors, some of them are here as well, and the research associates who have been part of these volumes. And I also hope that these volume serves as a major what we call the case studies that we have in India. If you look at public policy cases, you'll find that most of them actually, when we teach public policy, we don't have much experience, documented experience of how we teach of cases which comes from India, and that is where this volume actually fills the gap, because it brings in experimentations at the local level, which has been documented, also peer-reviewed and ready for use in terms of public policy education in India. So with these thoughts, let me congratulate all of you, all the editors and all the people associated with this work. Thank you so much for listening to me. Thank you.
Thank you, Professor Anjal. Ladies and gentlemen, before we begin our first panel on education, we invite you to a brief musical interlude. The song Vaishnavi Janato reminds us of empathy, humility, and service, values that lie at the heart of education and human development. We are honored to have this rendition by the acclaimed pianist, Mr. Siddharth Mukherjee. I invite Mr. Siddharth on the stage, please.
वैष्णव जन तो देने कहिए जे, वैष्णव जन तो देने कहिए जे, पीड़ पराई जाने रे। वैष्णव जन तो देने कहिए जे, पीड़ पराई जाने रे। पर दुखे उपकार करे तोए, पर दुखे उपकार करे तोए, मन अभिमान नाने रे। वैष्णव जन तो तेने कहिए। सकल लोक मां तहुने बंदे, निंदा न करे के नीरे। सकल लोक मां सहुने बंदे, निंदा न करे तेनी रे। वाच काछ मन निश्चल राखे, वाच काछ मन निश्चल राखे। धन धन जननी तेनी रे। वैष्णव जन तो तेने कहिए जे, पीड़ पराई जाने रे। वैष्णव जन तो तेने कहिए। समदृष्टि में कृष्णा त्यागी, पर स्त्री जेने मात रे। समदृष्टि में कृष्णा त्यागी पर सृजेने मातरे जिह्वा थकी असत्य न बोले जिह्वा थकी असत्य न बोले पर धन नव झाले हाथ रे वैष्णव जन तो तेने कहिए जे भीड़ पराई जाने रे पर दुखे उपकार करे तोए पर दुखे उपकार करे तोए मन अभिमान ना आने रे वैष्णव जन तो तेने कहिए
Thank you, Mr. Mukherjee, for that wonderful performance. The lovely performance has set the right tone for our first panel discussion based on the volume, Improving Learning Outcomes in Schools, Understanding the Challenge of Quality in the Indian Context. Edited by Professor N.V. Varghese, Ms. Vrinda Saroop, Ms. Anuradha Dey, and Mr. Amarjeet Sinha, this volume brings together 18 chapters by 22 contributors, offering grounded insights into why learning outcomes vary across India and what it takes to improve quality in school education. I'm pleased to invite our panelists to the stage, please. Please welcome Professor N.V. Varghese. Professor N.V. Varghese is a distinguished educationist and currently a visiting professor at IIT Bombay. He previously served as Vice-Chancellor of NEPA, founding director of CPRHE, and head of governance and management in education at IIEP UNESCO Paris. He has led international research across Africa, Asia, Latin America, and the CIS region. Please welcome Ms. Vrinda Saroop. In 2021, she received the prestigious Eden Prize for Education Development. A huge round of applause for our panelists, please. I now hand over the session to the panel.
Good morning to all of you. Thank you very much, the Bharti Institute of Public Policy, and also the two prominent editors of the whole series, Dr. Chatre and Mr. Amarjeet Sinha, and also the participants and others, so many others from so many volumes present here. It gives me immense pleasure to introduce the first volume that we are going to present today. And I am joined by Madam Vrinda Saroop and also Dr. Rukmini will be sharing of the introduction to this volume. This volume on improving learning outcomes in schools and understanding the challenges. And I should say that there is a serious effort that has been made by all the authors together, working together to provide a global perspective on the issue concerned, a national experience and state level experiments. So in one volume, you will be able to see all these stages or transitions that are taking place in the context of school quality or school improvement. I think I should start with introducing the book, which will be followed by the other two prominent members present on the dais. Education is a fundamental right and a crucial factor in economic and social development. The SDGs, the Social Sustainable Development Goals of the United Nations, underlines this importance of education, not only for attaining educational goals, but also for attaining all other goals of the SDGs. The GMR report shows that student enrollment has increased and reached almost universal levels. However, one finds that there is a stagnation that is taking place in enrollment, but at the same time, the levels of learning among the children are too low. That is the global learning crisis that is taking place. And that forms the major focus of this report, this volume. I think the commendable achievements are not reflected in enrollment and bringing children to school and to retain them in the classrooms is not reflected in terms of enhancing and improving the learner achievements. That is a major crisis, and that is the focus of this book again. This book focuses on, as I mentioned, in global perspective, national initiatives and state level experiments in this area, and also some of the good efforts done by NGOs in different states in the country. And you will find that the book consists of 17 substantive chapters, one introduction, and it is divided into 4 parts. Part 1 of the volume provides an overview and a global perspective, and also the national perspectives. Part 2 provides empirical basis for learner achievement studies in India, focusing more on India. And Part 3 provides successful experiments and experiences at the state level for improving quality, and also includes some of the efforts done by NGOs. I think it is important to understand that school quality is multidimensional. Therefore, it is very difficult to capture through the writing or even through any lectures. It is important to understand that the school climate, student engagement, development of citizenship, and facilities, teachers, etc. are important. But when we come to the question of making comparisons between India and other developing countries or developed countries in terms of quality of schooling, the indicator, it is not the best indicator, but it is the most commonly accepted indicator, that is measuring levels of learning or learner achievement is accepted mostly as one of the most accepted one. I am not saying that it is a perfect one, accepted indicator of quality. And we find that the empirical analysis have shown that students from affluent families do well in terms of learner achievement when compared with the students from lower economic or socio-economic backgrounds. This is true in the developed countries. This is true in the developing countries. In the developed countries, there may not be so much of distinction between these students from the upper income families to be attracted to a particular group of schools, although private schools form an important dimension. But in many developed countries, private schools are not at the primary level or even at the secondary level, are not a significant proportion. But in India, this is very important to see that there is a combination or a correlation or a multicollinearity between the students who are attracted to the private, or perhaps it is private, what we call as the public schools, the private schools, private English medium schools, and the family background. And you find that from that point of view, the measurement of student achievement in India is very much comparable with very few countries in the world. The developed countries outperform India, that is understandable. Even among the developing countries, some of the countries like Vietnam are classic examples of that we find. There are few that India participated only one of the occasions in 2009 in what is called as a PISA, which is one of the international comparisons, mostly based on the OECD countries or developed countries. And what is surprising was that our score levels were very low, perhaps the second from below. And after that, we did not participate for a fairly long period of time in the learner achievements, Within the country, if you consider that there is a substantial variation in learner achievement between schools and between states, between schools that you find. And one of the basic difference that we find is that between school variations are very high, generally in the developing countries and in the less developed countries and in India too. Between school variations are substantially high. But whereas within school variations are substantially high when we talk about the learner achievement, its measurement, and you kind to see that how this variation takes place, And that is very important to notice. So therefore, public policy, public provisions become more important wherever you find that between school variations are substantial. And you find that the in-school performance variations are to be reduced to the maximum when we talk about the changes that are to be made in the classrooms and in the schools. This does not mean that developing countries, less developed countries, need to focus only on between schools. We have a double duty, a double responsibility of making public provisions for schools, creating infrastructure, teachers, and all other facilities that are provided in the school. But at the same time, there is a need for improving institutional effectiveness, whereby the governance of the schools, the teaching community, and the student engagement become one of the important dimensions. India has started the process of quality improvement very substantially, and especially after 1986 policy. The basic difference between 1968 policy and 1986 policy was in terms of the change that you talk about. A common pattern was introduced, 10 plus 2 plus 3 system. That is a great achievement in 1968 policy. But 1986 policy concentrated most on inequalities and also quality of education. The MLL programs, the Operation Blackboard strategy that started, the diets that were established, the MLL, minimum levels of learning program that was introduced and that was experimented in India in different places are examples of focusing on how quality can be improved. For the first time in the planning framework, quality indicator was used as a target in the DPP, starting from 1994 DPP plans, when we said that 25% increase in the levels of learner achievement. And you find that the 2020 policy, NEP 2020, is not talking about schooling, is not talking about education, it is only talking about the quality or quality for all, not schooling for all. The slogan has changed from schooling to quality, schooling to learning. And several state examples, which I am sure that Madam Vrinda Swarup will be elaborating further, has shown that this has made a positive impact, although it may be limited in its outreach, but it has certainly changed. See, the Aadhaar scheme in Himachal Pradesh prioritized achievement of basic literacy and numeracy in the primary levels of students. activity-based learning in Tamil Nadu, Children's Learning Acceleration Program in Andhra Pradesh, Multilingual Education Program in Orissa, and Gunotsav in Gujarat. So many programs which are at the state level, and therefore it is important to see that. I think my time is coming to an end, so I had to stop here. So therefore it is very important to see that these initiatives have played an important role. So what is important to notice here is that it is not only the national level policies or the global perspectives, but also the institutional level interventions to improve policy are very important. And many a time you'll find that quality improvement requires a lot of investment, but a lot of things can be done without furthering additional investments if you reorganize the school activities and classroom practices. Or in other words, there is immense scope for understanding that even with the same levels of investment, financial investment and teacher deployment, we are in a position to achieve higher levels of learning than what is obtained in many schools. So therefore, that becomes one of the dimensions of change, not in terms of policy, but also in schooling practices, classroom practices, pedagogical practices, and to improve learning. Thank you very much. I will request Madam Vrinda Sarup to continue.
Good morning and a very warm welcome to all of you, ladies and gentlemen, who on a cold day have spared time to be with us today. It will be my pleasure to walk you through some of the key features of the volume. As Professor Verghese has already given you the main purpose of this book, but I thought I'll just walk you through some of the salient features of this volume on education, which is improving learning outcomes in schools. First and foremost, I would of course like to express my deep appreciation to Dr. Verghese and all those authors who have contributed to this volume with their rich insights and their very convincing experiential basis of the various practitioners, academicians, researchers, policy analysts who have worked on this volume. And of course, nothing could have happened if we didn't have the driving force, the energy, the guidance of Amarjit Sinha, who really put this whole exercise together, but who was a very close guide, friend, philosopher, editor, collaborator, author of the Education Volume 2. I also take this opportunity to thank the Bharti Institute of Public Policy and ISB, who have anchored this whole exercise and provided us with much guidance, especially a very, very fruitful interaction and workshop which Anjal led for us. And I think partly the volume is in its shape and size because of their support and guidance. So thank you very much. So moving on to the book, the key features which I thought I would mention to you today are really about what are the ingredients which make quality outcomes possible, and there are many. But this book focuses on 4 which are very critical. One, of course, is the teachers. They are the ones who make the magic happen in the classroom. The second was about school leadership. As is very obvious, a functionality for learning to happen, for the children to be happy, and the teachers to be able to teach with confidence. And lastly, of course, there's this whole issue which I think Professor Verghese has elaborated a lot on, and I'm sure Rukmini will also follow suit, is about the whole idea of measuring outcomes, measuring learning. So let me just elaborate a little on these themes and perhaps indicate to you which part of the books contribute to these stories. So India, you know, has made a very strong investment in building teacher capacities, teacher competencies virtually from the early years of independence. And some of it, the most lasting contributions which central and state governments over a period have been doing, is to bring institutional support for teachers both before they join the profession in training them, and what we call in-service, that is once they are in the system, to build their competencies and capacities there. So there's been a huge institutional system of right from the national level to district and now even sub-district level, where institutional support systems are already in place. And this confines itself not just to the infrastructure of it, but also the content, pedagogy, classroom management. As you know, we all have multi-grade classes in all our schools, non-discriminatory teaching practices, methods of assessment, methods of parent-teacher interaction, and so on. So in this context, I would commend to you the article on the institutional aspects of the teacher development in Padma Sarangapani's article in our volume, which looks at diets and which looks at pre-service arrangements for teacher training. Another important article in this context is the one by Anuradha Day and Meera Sampson, who look at Haryana as a case study to see how teachers are trained, how effectively that training is transacted, and so on. And it is worth it looking at both the institutional arrangements and actually the realities on the ground. There was also a huge effort to empower teachers, to vest them with autonomy, to vest them with their way they run and manage their classes. And I think that's critical. And in this, there are a few articles I particularly would like to mention. Is the Nalikali experiment of Karnataka, which Sanjay Kaul has brought out, and the activity-based learning in Tamil Nadu, which Vijay Kumar has written. And these are practitioners who have looked and transformed schools. So it's a very interesting examination of how actually a teacher empowerment can work for the betterment of schools and learning. So there are a lot of myriad steps which contribute to the teacher performance, to quality improvement, and some of those are even in my article in the book, which looks at, apart from teachers, but also at textbook reform, looks at the materials, the pedagogy, the teaching learning practices, and so on, and which gives you a conviction that yes, we are on the right path. But this book also examines the futuristic line, which is we have failed in our proper recruitment systems for teachers in our government schools. You've heard of the scams, you've heard of the, some have political and bureaucratic people have even been jailed on this. So this is an area which we have flagged as needing a lot of change and reform. We also look at how we can improve pre-service institutions. And we know how iffy some of those institutions are, and not the ideal way to prepare our teachers for government schools or any schooling for that matter. And of course, lastly, we also looked that futuristically, we must have systems of building gracefully teacher accountability, teacher performance measurement, so that these are some of the areas which our future will help the schooling system. I also turn to the school leadership, and in that in particular, I would commend an article by Girdhar, S. Girdhar, who has done a brilliant collection of case studies of how, even in very adverse circumstances, a good school principal, a good school headmaster has changed the whole way that school runs and how effectively learning takes place. So I do commend that article. It is really worth reading. But again, we have said in future, it is our system's fault that we do not even appoint regular school heads in time, neither do we empower them. So there's a lot of reform in that area, which this book is commending. We also look at school management, and there are some wonderful articles in this as to how the system has actually got to support the schools, has got to work in tandem with schools, heads and teachers to be able to make a school effective, to have the community and parents have faith in that system. And there is wonderful work which is going on in the States in this, because that is really the cutting edge level. I commend Nand Kumar's article on high-performing schools in Maharashtra. There is an article on Bihar's efforts by Moin Saab and Mr. Singh. There is an article by Vijay Karan Anand from UP on the Kaya Kalp program, which they are running to be able to make schools effective. And there is a wonderful article on how Punjab has done this by Arushi Jain. So these are articles which are worth looking at, that what is possible. But still, this is work in progress, and it has to be much more universal, much more in-depth for all our schools, government schools, to be able to perform with sensitivity and support for the system. And finally, I think I mentioned about how measurement is important, and measurement of student learning in particular is something, as Dr. Verghese said, that we really institutionalized it in 93, 94, when we started the national assessment surveys. And happily, this is a process which has grown and come to full fruition, when not only are national surveys done regularly after every 3 to 5 years, but also it has created a lot of interest and effort by the states to be able to do their own scholastic assessments, and which are much more detailed, much more granular, and therefore much more actionable. It has also given space to Rukmani's organization, who brings out the Asar report, and many other NGOs who have got into this space of assessments, which is actually very effective in putting the spotlight on where we are or what we need to do. And it is turning pedagogy into looking at teacher performance, but also looking at where that teacher needs help, where that change is required, what are the areas she needs help. So it's assessment not in broad brushes, but it is actually to make schools more effective. So I thank you all for your patience, and I hope this volume is of value to practitioners, to researchers, and anybody who is actually concerned with Indian education. Thank you for listening. Thank you.
So, thank you so much. It's working, yeah. I'm not going to stand there because I think those flowers are very beautiful, but they hide the speaker. And so I'll stand here. What you can't see is that our clock is already at a 0. And I've received a note saying, please be quick. But having woken up on a Sunday morning and come here, I will take a few minutes at least to add my bit to what Vrinda and Dr. Verghese has said. The section in our volume, there is a section on data and measurement. And I'm very happy that in that section, I think it is a very, in fact, this morning I sent it out to many people saying it's a very good place which captures a lot of India's history for the last 20, 25 years on work that has been done on learning outcomes, but I think also a big history of the measurement of it. Two small stories I want to say to highlight some things that have been mentioned in the 4 chapters that we are talking about. The first one is from Karnataka. It's a personal story. We were working with the government of Karnataka on a program called Odu Karnataka, which is basically a teaching at the right level, which is something that we have developed, which was being done in Karnataka schools for grades 4 and 5. As the program rolled out, a key part of it was to do a baseline, a midline, and an endline, with using a very simple process, which is very much like the USR tool. At that time, the SCRT director was somebody called Mr. Bela Shetty. Some of you may know him. I think he's one of the most, I would say, I have learned incredibly a lot from him. And he came to me and he said, in these next 3 months, how many times should a cluster coordinator visit the school? And he always has a little pad on which he notes down important things. So I said, this was our first time working with the government of Karnataka. So I said, sir, it would be good if a cluster coordinator could visit in these 3 months a school 6 times. Now, how many times the actual coordinator visits was, of course, much less. Mr. Bela Shetty did not even blink. In his notebook, he wrote down 6 times. And then he said to me, explain to me the rationale for each visit. So I said, pehle to baseline, first when you do the baseline, we must make sure that the teachers, although they've been through the training, have a good sense of why the baseline is being done. Baseline is not being done just because you've been told to do it. The baseline is being done to actually understand your class. The second round would be, once the baseline results are available, to see that in my 15 or 20 schools, there may be some schools who have quite low baselines and some who have higher baselines. So presumably I start with helping the low baseline schools. Midline, I said by midline we have seen that there are some who make a lot of progress even if their baseline was low, and some who haven't made that much progress. So after the midline, it is important to go to the schools which haven't made as much progress as could be expected, and so on and so forth. Mr. Bela Shetty, in his notebook, wrote these things down. He may have had questions to me, but he didn't voice them. When at the end of that 3 months we looked at the data, the average number of schools visited by each cluster coordinator was not 6, but was 8. And you could actually see from the data the way that it was 8, the high baseline schools had received much less visits. The low baseline schools and the low progress at midline had received many more visits. And you could almost see, although this is not causation, but you could see a strong correlation between the support to the school and the progress that the school had made. I think the purpose, the reason I'm illustrating this, is that how can data available on a timely basis really help the system to help those who need the most help? Because I think that the challenges are about the variations we see, the variations of children in our classrooms, the variations of schools across my cluster, the variations of blocks across my district, and the variations of districts across my state. And each of them needs the help, I would say, at the right level. And one of the ways to do it is, I think, to provide this differentiated help based on data that can be easily available. I think the authors in my part of the section all dwell on this in one way or the other. But I think this timely data with the right purpose at the right level, if it is understood by people in the system, then I think it really helps to improve the performance at that point. The nice thing about it being 0 is it can't go below 0. So I can speak a little bit more. This is now cutting to an experience that I had. This was a summer camp we were running in Junjunu district, which is where Pilani is based. And this was with slightly older children. And we were trying to get at what can be done to help children dig deeper into a text and be able to come up not just alone with their comprehension, but as a group of kids. So there were certain cases we developed, little stories or little contexts in which we wanted these groups of children who were anywhere between 13 to 15 to actually come together, discuss the situation, and come up with what they could put out as their opinion. I'm not talking of this as an assessment, but I think these are the kinds of things which are very difficult to measure quantitatively. So here's the case that we put out, that there's a group of kids who are playing football in the village field, एंड उसमें से एक बच्चे को प्यास लग जाती है, एंड प्यास लगती है तो उसके फ्रेंड का घर बिल्कुल मैदान के बगल में था, तो वो अपने जल्दी से भाग के फ्रेंड के घर में जाता है और पानी मांगता है, एंड द मदर कम्स आउट विद द वाटर, एंड द किड सडनली रिमेंबर्स कि उसके अपने घर में बोला जाता है कि फलाने फलाने लोगों के घर से खाना पीना नहीं करना चाहिए. What should he do? This was the context. The first 15-20 minutes, we could see the kids discussing, but you could feel that your discussion ho raha tha, it was not at the right place. The kids kept saying, कि सर इसका आंसर इसमें तो नहीं है, तो हम क्या करें? And I think this is something that all the authors in my section have really dwelt at, that rote learning or the expectation that children have because of the way we give them the questions is that the answer is inside the text I've given you. So it took us actually much longer in that time that we had with the kids to say, सवाल का जवाब इसके अंदर नहीं है, सवाल का जवाब आपके दिमाग में है, ये तो सिर्फ आपको सोचने के लिए कॉन्टेक्स्ट दिया गया है. And it took a lot longer than you'd think to convince them that answers can exist outside of this. Once they were convinced, and we said, this is not there's no worksheet, there's nothing, you're not going to be evaluated on it. I want to evaluate it on what you say. And then kids were really free. It took a little while also to come together to give an answer. But basically, you would be very happy to know that most of the group said, वो घर में लोग कुछ कुछ बोलते हैं, but अगर मैं अपने फ्रेंड के साथ फुटबॉल खेल सकता हूँ, तो उसके घर में पानी भी पी सकता हूँ. घर में जाके सबको ये सब बताने की जरूरत नहीं है. I'm going to stop in 1 second. So I would say that behind assessment is all the interesting things that happen in classrooms, all the interesting things that happen with our entire educational structure, leaders, cluster coordinators, blocks. And I think that the one way to link them all together is by really looking at what kind of data would help us to do this better. One of our speakers in the beginning said that we are not likely to reach the Sustainable Development Goals. I don't know much about all these other goals, but I do know that 4.1.1a, which is basically the goal that Nipun Bharat is chasing, the goal that every child can reach a certain level of foundational literacy and numeracy by 2030, I do think India has a fighting chance for this. If you look at the results from 2024, both Parak that NCRT has produced, Asar that has come from us, shows significant improvement for the younger age group. And I do think that that momentum can be maintained and it can be fueled by many things that my authors have spoken about, but also if we keep looking at the progress that our children are making and being able to support the schools to be able to do it. So it's a challenge, I think, to all of us, that I think at least one sustainable development goal can be done, but it needs concerted effort. And I think that what the volume gives us is a lot of food for thought about how to do it. Thank you.
Thank you to the panelists for an insightful discussion. It surely sets a tone for all of us to go through the volume in detail. I would like to request Mr. Amarjit Sinha to please be on the stage and kindly felicitate the panelists with the token as a token of our gratitude. Thank you, Mr. Sinha. Thank you to all the panelists. With that, we now move on to our second panel on the volume titled Healthcare for All, Community Action and Public Systems for an Inclusive India. Edited by Professor K. Srinath Reddy, Dr. Girija Vaidyanathan and Mr. Amarjit Sinha, This volume examines India's evolving public health landscape in the post-COVID era. With 20 chapters, authored by 32 scholars and practitioners, it brings together rich micro-studies and policy analysis. I'm pleased to invite our panelists on the stage, please. Please welcome Professor K. Srinath Reddy. Professor K. Srinath Reddy is a distinguished public health physician and the founder-president of the Public Health Foundation of India. Trained in cardiology and epidemiology, he headed the cardiology department at AIIMS, Delhi. He holds global academic roles at universities of Emory, Sydney, and Pennsylvania. Professor Reddy has authored over 570 publications and received honors including the Padma Bhushan and the WHO Director General's Award. Please welcome Dr. Pavitra Mohan. Dr. Pavitra Mohan is co-founder and executive director of Basic Healthcare Services. He previously worked with UNICEF India, leading national child health programs, and taught at RNT Medical College, Udaipur. A pediatrician by training, he holds MBBS, MD, and MPH degrees and is a National Neonatology Forum of India Fellow and an Ashoka Fellow. Please welcome our third panelist, Professor T. Sundararaman. Professor T. Sundararaman is a retired public health physician based in Puducherry, noted for major contributions to India's health policy and systems, former executive director of NHSRC and key architect of NRHM and ASHA. He currently serves as senior advisor for health technology assessment to the Department of Health Research, Government of India. I now hand over the session to the panel.
Good morning. Firstly, I'd like to thank my co-editors, Mr. Amarjit Sinha, who bore brunt of the work, and Dr. Girija Vaidyanathan, who unfortunately is not here present today, but who also contributed substantially to the configuration as well as completion of the volume. When it comes to Mr. Amarjit Sinha, it's very clear that whenever he develops a volume on human development, it is obviously characterized by a double helix where the DNA has both robust public systems as well as a strong community connect. And this volume also reflects that very clearly in terms of the composition. The key messages that are emerging from this particular book is the recognition that health, of course, is very pivotal to human development, but that we need primary care-led universal health coverage, a public sector-led integrated healthcare systems across levels of care, systems of care, and categories of providers, that we need decentralization of funds to states with enablement of state-level innovations which can greatly enrich and strengthen even national health programs conceived and initiated at the central level. Also, that we certainly need community-led health system transformation and convergent human development approach, which brings together health along with other vital sectors of human development, which of course this whole series of volumes represents. The authors of various chapters have clearly looked at various aspects of health based upon their own experience, as well as looked at national and global learnings. They have looked at public financed health insurance systems, the challenges of a health workforce which is limited in numbers, skills, and is maldistributed across the country. They've looked at pharmaceutical production and regulation, where despite being the pharmacy of the world, we do face challenges in terms of drug pricing and quality. They've looked at urban primary health care, which has been an area of neglect, while the National Rural Health Mission was subsequently transformed into the National Urban Health Mission, with the addition of U standing for urban. There has been a U-turn in the National Health Mission, where the urban component is still facing an area of considerable neglect in terms of both financing and implementation. There's also been a strong focus on looking at how the two principal pillars of Ayushman Bharat, that is primary care and also funding for hospitalized care through the Pradhan Mantri Jan Arogya Yojana, have been functioning, and also other government-funded health insurance schemes which may have been initiated by states, initially independently, but now functioning in conjunction with the Pradhan Mantri Jan Arogya Yojana. The whole idea of universal health coverage, therefore, receives considerable attention in the volume, where we find what are the challenges in terms of inadequate primary health care in rural areas and certainly in urban areas. And we find that the whole area of Pradhan Mantri Jan Arogya Yojana, which has a fundamental disconnect with primary care, is paying a penalty for that, but also the challenges faced in terms of actual implementation of the insurance programs in the state level have been studied in terms of what the challenges in terms of both affordability and quality of care are, and where the challenges lie also in terms of complaints, in terms of how the providers are also finding various areas of dissatisfaction. But as Dr. Shiv Kumar's chapter on universal health coverage points out, the whole idea of universal health coverage being based on insurance is untenable, particularly when the insurance coverage is also limited to certain categories of people and not covering many other sections of the people, what's now come to be known as the missing middle. The idea of actually ensuring that universal health coverage truly provides everybody with all the needed health services, which are coming without a financial penalty for people who have access to those services, that is an important element that's brought out as a part of state responsibility, as a responsibility of the government, and not necessarily to be mediated by insurance companies. And that's a message that comes out strongly across the book. Then we also see that in terms of the urban health mission and the area of urban health, where does the health lie in the cities? And some of the experiences have been pointed out, particularly the poignant experience of migrants living in urban and peri-urban areas have been highlighted in a couple of chapters, and Pavitra will probably speak to it, having been an author of that chapter. Then we also have an issue related to the environmental determinants of health and the commercial determinants of health, which have been written about in considerable detail in the chapters. And it's particularly pertinent in these times when not only air pollution is really clouding not only the skies, but also clogging the lungs in the national capital region. And when we find newspaper reports that powers that be deny that there is any connection between air pollution and health, and certainly saying that there's not only no mortality, but we don't have data about health conditions being responsible, being linked to air pollution, I think that particular chapter bears reading. In terms of non-communicable diseases, the fact that there is a considerable addition to the burden of disease in terms of rising burden of non-communicable diseases, adding to maternal and child health conditions as well as infectious diseases comes out clearly. And this is an area where the commercial determinants of health become very important as well. And there's a strong chapter on that, where it's not only the experience of tobacco, but now of ultra-processed foods coming up to the fore, and very many other commercial determinants coming in. There was a mention initially that we are unlikely to reach our SDG goals. But may I comment that not all the SDG targets are really relevant or applicable to India. In NCDs, the global target is that we must reduce premature mortality between the ages of 35 and 70 by 1/3 by 2030. But this is a target that is set for a global population, but it does not take into account that health transition occurs, epidemiological transition occurs across societies. As the younger populations of Africa move into middle age, that's where NCDs are going to strike in large numbers. As the middle-aged population of India moves into post-60 and post-70, that's where NCDs are going to pile up. Therefore, having a single yardstick for the whole world did not make sense then, it does not make sense now. Nevertheless, the fact that NCDs are important, and we also need to pay attention to the still persisting challenges of maternal and child health and communicable diseases in conjunction with the growing importance of NCDs is something that the book does bring out. But the important element is also, do we have the health workforce to meet those challenges? The experience of ASHAs has been very well highlighted, and certainly Sundar is going to be talking about it as one of the things that he has really initiated through the Mithanin program. But also the NHSRC at a level of policy making and program development where he has had considerable experience. That's also very clearly brought out in the book. But community-based interventions are absolutely critical, and that's something that's been highlighted again through different chapters in the book. We also know that there are global insights, particularly in terms of primary care, where some chapters do highlight how countries like Thailand and China have really looked at integrated healthcare systems where primary care is linked to other higher levels of care in a bidirectional fashion in a very efficient manner through both health system innovations and through financing programs. And there are lessons for us to learn in that. But certainly we know that there are very many other determinants of health, as has been pointed out in the introductory remarks, that education, environment, all of these, social development, all of these are integrally, bidirectionally linked to health. And therefore, whatever is written in the health volume should be taken in conjunction with the other volumes, which really bring about the synergy that exists between various elements of human development. And therefore, the message which rings true in this volume and the CDs as a whole is that we must proceed from silos to synergies. Thank you.
Good morning, everyone. Thanks, to Mr. Sinha, who encouraged us to write this chapter and also to invite for the panel, and of course to Bharti Institute of Public Policy and all of you who are here this morning. I would speak about the chapter that we had done on healthcare of the migrants in India. And when I say migrants, I mean often people say that all of us are migrant. We came from there and we came from here and now we're living in Delhi. But the migrant that I'll be talking of and we've written about is about the labor migrants, which is not a migration out of choice or for aspirational progress, but it is out of distress. As the chapter says that it's very difficult to estimate the number of migrants, but they're fairly large numbers, and some estimates of the labor migrants range from 3.5 crores to 5 crores, which means that about 5 crore households, that translates to around 20 to 25 crore population, which is families which are sustained by migration in one way or other, which is increasing, by the way. So if you look at the literature on migration and health, one often comes across a lot of articles on HIV, where migrants are considered to be perpetrators of the disease. And, and when we started working in the areas where there is a huge out-migration, we started realizing they are not perpetrators of the disease, they are often victims of an unjust society and the systems which perpetuate disease and disability and illness and injuries among migrant populations, because most of them are among the most socially vulnerable, as well as work in hazardous and informal sectors where living and working conditions often push them to ill health and early deaths in many cases. Another point the 2 points I would like to make before we go to specifics is that migration in India is often circular and seasonal and predominantly single male migration, though increasingly there is more of family migration as the rural distress increases. But predominantly it is circular, which means that people keep coming back to the cities and to the villages. So often when we talk of migrants, we only think of cities and we think of what can you do in the cities, but they're often migrating between the rural areas and the cities. And many a time the families who are not in the cities with them are in the area. So one needs to look at both the destination and the source of where people live to be able to design a sensitive and a responsive initiative or even an understanding. Based on our own understanding and insights of having working in high migration areas in South Rajasthan and with our colleagues who work in many destination cities as well, we argue in this paper that there are 4 factors that primarily affect the health of the migrants adversely. The first and very significant one is nutrition. So both from the areas that they come from and where they go to, poor nutrition, poor availability of food and other determinants of nutrition drive ill health. They are undernourished, and many studies that we have done in both in the cities and in the rural areas, we find that there are very high levels of malnutrition, much more than the state averages and even the rural averages. And these are areas which are often food scarce, and that's one of the reasons what also drives migration. Something that is changing over years is that in cities we are seeing a combination of overweight and underweight, but both of them are driven by poor food practice, availability of non-nutritious food. Either a lack of food drives undernutrition, but a lack of but increased poor quality of food is what is driving overweight. So we are seeing both in some cases. In the poorest areas, it is still that shift has not happened, but in other areas it is both, but both of which affect health adversely. So that's the first kind of determinant. The second determinant is work per se. So the nature of work that migrants do is often at the lowest level. Often those work where the local workers, even the poorest one, would not want to do. So the most hazardous work is given to the migrants because they find it, they are in distress, so they would do whatever work is available and several of our colleagues have documented how the work leads to significant injuries, for example, in automobile factories in Gurgaon, etc., where thousands of workers lose their limbs every year. There is work like silicosis, stone carving, and other work that drives respiratory illnesses. In fact, we see a lot of people suffering from tuberculosis, which is very clearly linked to work, which leads to inhalation of dust and smoke. Almost every work that people in informal sector, and especially migrants, do is hazardous in some ways or other, a lot of them destroying their lungs. The third factor that drives ill health is housing. I'm sure some of you would have seen how migrant workers in the informal sector live in the cities. So we often talk of migrants living in slums, which is quite far from truth. A lot of migrants who live in slums are those who have lived there for 15, 20, 25 years and have been able to live there for that long without returning to the cities. Most of them live at work sites, on streets, etc., and in extremely overcrowded situations which perpetuate diseases of respiratory origin, heart diseases, etc. Ill ventilation, absence of water and sanitation in those areas also contribute significantly to ill health. And in absence of an housing which is dignified, which is safe, which is healthy, it's difficult to envisage how can we really talk of health of the migrants. The fourth factor, of course, is access to healthcare, which is often unresponsive to needs of the migrants. You're more comfortable, and that's the reason when we started working, I often wondered that why is it that people return to villages from cities like Ahmedabad and Mumbai, which are the health hubs, so to say, where all the health facilities are available. But at the slightest of the distress, people return to villages because the health systems in cities are not designed for migrants. People can't speak the language, they are far, they are unfamiliar. They are often asked for domicile documents which they don't have, and therefore they would rather return to villages where they at least know what is available, even if it's of poor quality. Finally, of course, it affects women much more adversely for various reasons. For example, one of the examples in the book is based on a study that some of our colleagues did in Ahmedabad, where women have to walk for 2 to 3 hours to find a safe place for defecation in the morning because in absence of toilets at the workplace. So many other reasons why women also find it even more, at a rough edge. There are also several solutions and some innovative solutions, some commonsensical solutions. So most of them are commonsensical solutions. Many of us know about some of them. For example, for nutrition, the creches and the canteens at different places have been tried, some at scale, some at smaller scales, but absolutely imperative, something that can be easily incorporated in the public policies and scaled up hugely. Creches, for example, is something that I think is an absolute basic right for every child, wherever the mother is working. Canteens in several states have shown significant improvement in nutritional outcomes and access to safe and healthier food. Need to do much better in terms of diversity of food, but access is definitely improved. Having a portable, okay, sorry. I think Sundar would be left with no time. At workplace, there have been several examples of facilitating access to safety. Safe in India is a foundation working in Gurgaon that has helped people access ESI facilities, but again, much more needs to be done. There have been e-logs of injuries to at least bring out the possibility. So there are several other examples of migrant-responsive healthcare facilities, as well as some housing innovations, including policy gaps. But I think one of the points that the paper makes is that for a country whose future is dependent ultimately on the migrants working in cities and in towns, we do need to have a migrant and health policy. In absence of that, it is impossible to envisage how would we account for a large number of people who are not in fluctuation and in movement. And countries like China have a very significant policy. The moment that they started having significant urbanization, had a migrant-responsive health policy, a separate policy for migration and health, and that's absolutely imperative. Besides some of the solutions that are suggested to be scaled up for this segment of people who are, in some ways neither here nor there. So, thank you very much.
Thank you. Thank you for this invitation. I must, of course, thank Amarjit Sinha, whose undying energy is a source of inspiration to all of us. We are all very happy if we release one book. And this guy wants to release 6 books at the same time. And that's a lot of doing. And all of them are very detailed. And in all of them, he has played a pioneering role in each of these areas in the implementation of it. There's a big difference between writing papers for publication in peer-reviewed journals
and writing chapters for books, especially chapters for books that Amarjit Sinha commissions. The charm of this is that we begin with our practice, and the theory, we then relate it to the theory. Very often when we are writing papers, you are really developing upon knowledge and we're developing upon a framework. And very often over here in this book, we are documenting what we have actually experienced or done, and then trying to see how it fits and trying to reflect on it and try to make meaning of it for a larger, longer, sustainable understanding of it. I find that's a very interesting challenge. I thought I had done that because I'm very upfront about it. I took the opportunity to write down, okay, he's invited me, so he gets what he asked for. So I wrote a whole lot of experience, which otherwise I don't think would have any particular space for publication, because it's a certain experience of how the programs actually evolved and how they played out in a role. But then I was happy to see that if you look at this overall book, there are in the first some 5 or 6 commentaries, the overall view of how a different take on universal health care. But then there are, I think, 5 chapters which are all on themes, 5 or 6 chapters. I thought Poonam had done the same thing with community action for health. Really tried to document what had taken place in community action for health in the 20 years or more of experience in building health systems, and then lightly put a certain structural, theoretical structure onto it. Actually, a very detailed thing. So if there are schools of public health teaching health systems and health thing, nobody actually has a resource where you will actually find examples of these things. You can find it assorted over a number of papers, but that doesn't tell the story of how community action for health evolves. Similarly, there is one on PMGYs, which is again about the schemes and its implementation, how the lived experience of it in a number of areas. There is one on health and wellness centers, so that's a preliminary area, which is again a lived experience on that. There is one on the Kerala's one is on pandemic response, which is also a certain experience of what has been learned from that. So you have a number of things, and Garima, of course, documents, and she does it very faithfully. I think she didn't even want to do too much theory on it. She does a detailed documentation of what happened in the ASHA program. So leaves a trace for people who are subsequently working on this to know just exactly what happened in these areas. And then there are a set of papers that are exploring themes. So the themes on migrant, we've heard the thing, but there is also themes like the knowledge management area, what actually means to build a learning adaptive system, the building blocks of health systems. Again, I will find this very useful for scholars in public health, future researchers, and future practitioners who are grappling with problems in that area. I would recommend you to read this health workforce chapter, though it's data heavy and rather confusing on the data, because it brings up a big point which hasn't been made elsewhere in literature up to now. It's about the growing problem of unemployment in the medical force and the huge proportion of people who are qualified but not working on using their qualifications. So there is a section with unqualified and providing medical service, and there is a larger section who is qualified and not providing medical service. And there is a whole set of people who are unemployed. I wouldn't go quite with their conclusions, especially their first conclusion, but you must read it to find out what it is. Because I'm just keeping some of the disagreements that I have on this. If I wasn't sure whether the mandate here was a peer review or an introduction or a presentation, so I'm sort of hedging on that. But I think there are things on which, if we as practitioners read it, we'll all have our own take on that. And that's, I think, very interesting, because it sort of, what we do in our textbooks, and that mental health chapter is a bit of a textbook chapter, because I can understand it, there's not enough experience on the ground to reflect on. There's hardly anything happening in mental health. There's a whole lot of blah, blah at the policy level, but on the ground you have very little presence on scale. So that textbookish. But very often what we read in the normative literature, when we go to the field, there's no use of that, because that's not how the field behaves. And therefore most practitioners say, oh, to theory hai sir, usse koi kaam nahi hai. And at some point, unless we are working on it by taking practice and then theorizing on it in some form, we are not very useful in guiding health policy and system studies in the country. And I think, therefore, this book plays a niche role that very few other books have done. And I think, I would say there is a chapter on the theme of urban health. There is on commercial determinants, a very limited understanding, restricted to just tobacco, alcohol, and sugary drinks, whereas commercial determinants are much wider. The pharmaceutical sector, the theme of health, air pollution, and of course this. So each one of these themes are themes in which there's a huge exploration that is grounded in practice, and that only uses theory to reflect upon their own practice and to understand why we are seeing what we have seen and why we have experienced what we have done. So I hope you do enjoy this and you do your little bit of writing and reflecting on it. I think these are better. I was telling Amarjit that these are not books that are really to be read like that. These are books to be transacted. There are chapters around which we should construct a discussion if you are going to really appreciate it. And say, do we agree, okay, his findings, we agree, we appreciate his practice, but do we agree with the conclusions? Would we like to make different conclusions of this? So I hope these chapters are transacted. I haven't read the other volumes, but it is an exciting journey because of where Amarjit starts and where he proceeds from. Thank you.
Thank you to the panelists for sharing an overview of the chapters which constitute the part of the healthcare volume. May I please invite Professor Anjal Prakash on the stage, please, to please felicitate the panelists. Can we have a huge round of applause for the panel? Thank you, everyone. As we now transition to our next panel discussion on nutrition, we will pause for a moment of reflection through music. The song, "We Shall Overcome," has long stood as a collective expression of resilience, dignity, and shared responsibility, themes deeply embedded in struggle for equitable nutrition and well-being. I now invite Mr. Siddharth Mukherjee to the piano, please.
So now, this is perhaps a song where I could ask you to help me. So this is a song that I believe we should all sing along. shall overcome. We shall overcome. We shall overcome someday. Oh, deep in my heart, I do believe that we shall overcome someday. Can I hear you? We shall overcome. We shall overcome. We shall overcome someday. Oh, deep in my heart, I do believe that we shall overcome someday. We are not alone. We are not alone. We are not alone today. Oh, deep in my heart, I do believe we are not alone today. We'll walk hand in hand. We'll walk hand in hand. We'll walk hand in hand someday. Oh, deep in my heart, I do believe we'll walk hand in hand someday. The truth will set us free. The truth will set us free. The truth will set us free someday. Oh, deep in my heart, I do believe that we shall overcome someday. Amra korbo joy, amra korbo joy, amra korbo joy, nishchoy. Oh, moner gobhire ache proত্যয়, amra korbo joy, nishchoy. हम होंगे कामयाब, हम होंगे कामयाब, हम होंगे कामयाब एक दिन। ओ मन में है विश्वास, पूरा है विश्वास, हम होंगे कामयाब एक दिन। আমরা করব জয় নিশ্চয়। We shall overcome someday.
Thank you, Mr. Mukherjee, for that lovely musical performance. On that positive note and with hopes in our heart, we now move on to our third panel based on the volume, Improving Nutritional Outcomes, Connecting the Dots Through Grounded Action. Edited by Dr. Vandana Prasad and Ms. Aarti Ahuja, this volume examines nutrition in India as a multi-dimensional human development challenge. With 18 chapters by 36 authors, the volume spans macroeconomic and social determinants, food and health systems, women's agency, vulnerable groups, and community-led interventions alongside state-level initiatives. Please join me in welcoming our panelists on the stage, please. Please welcome Dr. Vandana Prasad. Dr. Vandana Prasad is the community pediatrician and public health professional with over 30 years of experience in health system strengthening and malnutrition. The founding secretary and technical advisor of PHRS, she has served as member Child Health at the National Commission for Protection of Child Rights. Please welcome Ms. Aarti Ahuja. Ms. Aarti Ahuja is a retired IAS officer with over 34 years of experience in public administration. She served as secretary in the Ministries of Health, Labor and Employment, Women and Child Development, and the Department of Chemicals and Petrochemicals. She has also contributed to COVID-19 health management efforts, nutrition programs, worker welfare reforms, and continues advisory and academic engagements. Please welcome our third panelist, Ms. Mirai Chatterjee. Ms. Mirai Chatterjee chairs the Seva Cooperative Federation and was the director of the Social Security team of Seva. She chairs WeGo, serves on board including PHFI, Save the Children, and Pradhan. Ms. Chatterjee has advised government bodies, served as a WHO commissioner and a NAC member. She has received Johns Hopkins University's Global Achievement Award. I now hand over the session to the panel.
Thank you very much. It's on to be on mine.
Hello.
Hello. Yeah. Thank you very much. And all three of us are delighted to be here. Our panel is structured a bit differently. We're going to be asking each other questions. So I'll start straight away. I would like to ask Vandana, you first. How did this volume come about? What was the need for it? What was the thinking behind it?
Yeah, thanks so much, Mirai. And that is not correct. So we are starting at 30, not 24. Correct it, please, organizers. Yeah. So thanks very much. I mean, this volume has been a huge labor of love for everybody, but I think just at the outset, people have been saying it from the morning. This is Amarjit ji's brainchild, and it's been his kind of almost manic energy, as Sundaraman was saying, that has really brought this to fruition for all of us. I mean, like, I know personally that if I had not been arm twisted by him to edit this volume, I might have written in it, but certainly not have embarked upon this kind of a journey that's been so very rich and so very fruitful. And without, I think, the backing of BIPP, this would not have come about. There were initially, I think, a lot of conversation that happened between Amarjit ji and BIPP as a preliminary before even, the first lot of consultations happened where I was invited in as a potential editor and definitely as an author. And I think the theory and the philosophy behind it is, akin to what Sundaraman was just speaking about. That essentially there is this big gap that exists between policy making and practice. And that's really highly the case in nutrition, as all of us know. We're all, we've all worked in the public health nutrition space. The gap between policy and practice is major for many reasons. And the reasons exist at both ends, at the ends of the policymakers as well as at the ends of the practitioners on the ground. And perhaps we'll have something more to say we have very little time today. So it was, I think the main purpose is to bridge the gap, but starting where? That's also really important. It was very important to us to ensure in this volume that we started from the grassroots practitioners. But these are not just any grassroots practitioners. There's a lot of good work happening at the level of the grassroots, in villages and slums and so on. But this was slightly different, and that expresses itself in the nature of the chapters that follow in the book, which hopefully Aarti will speak much more about. And that was that these were practitioners who came from expertise, practiced on the ground, and had actually made an effort to rigorously document that, as well as try to make inroads into public policy. So it was already that case. There are many, many others who need to be documented, and we need to go through the rigor of, empowering them to be able to inform policy. But in the ones that we chose, we knew were people who were practicing on the ground, and there are many examples of that. See, 14 out of 18 chapters are coming from grassroots experience, but one that links the micro to the macro in very specific ways. So in one, for example, the group has been through PILs and legislation, informed through committees and so on, policy work. In another also, people have tried to inform policies through being part of many commissions and so on and so forth. So each one of these practitioners had rigorously tried to document, had published, had decent data, and had made efforts to inform policy in their own ways, but insufficiently so. I mean, that gap still remained. So I think that was what we understood, that gap needed to be covered. We were very keen that we must connect the micro and the macro, and that's why the title of the book also, essentially says that. We all understand nutrition is so multifactorial, multi-sectoral, and so many different, and as civil society, we can only do very small amounts of work because of our limitations, not necessarily a limitation of the mind or the vision, but a limitation in terms of capacity. So, but we could understand that we need to connect all this to be able to inform policy in a way that, you know, encompasses the larger determinants of poverty, gender, agriculture, so on and so forth. Just as health is everything really, nutrition also is in some sense. So that's really how it came about. And then there was a lot of effort made to pull in the people who contributed, and they've been fantastic. Major contributions have come through, which perhaps we might get some other space to talk about in greater detail.
Thanks a lot, Vanna. Aarti ji, may I ask you, what's the book about?
Thank you, Mirai ji. In fact, let me put it like that. I think this book combines Vaishnav Janto with ISP. In the sense that you have a whole lot of people, like Vandana said, whole lot of people with their heart and soul on the ground doing fantastic work, but not getting the space at the public policy level to showcase that evidence. So what this book does is actually bring that rigor of research and evidence to people whose heart and feet and actions have shown that they care, and bring it to that rigorous kind of level. So the first thing is that. The second thing is that today we are the 5th largest economy in the world. We still have problems of undernutrition and now overnutrition. We all know what needs to be done. It is multi-sectoral. How is it to be done is, I think, where the gaps in our knowledge still remain. This is not, I would by any means say, complete picture, but it brings together diverse voices. It brings together diverse experiences, and it is for us to then decide which of these experiences is contextual to us, and we can learn from that. The third thing it does, I think as editors, we were very conscious that we will not change anybody's worldview or point of view. So often the articles are at odds with each other. But again, as I said, that it is for us to pick what is the most relevant. And here I would really like to thank also Mr. Amarjit Sinha, because he was like the guiding star for all these discussions and the whole editorial process. And especially Vandana, whom I got to know a lot more better, and hats off to her sense of professionalism and her sense of deep dive, and no, honestly. And of course to the authors, from whom I have learned so much, the tremendous amount of work that is being done. Coming back to the book, very briefly, it's in 4 parts. So firstly, setting the context, overall, global and national, what's being done. Then we have the voices from the ground, the multi-sectoral action, how at the ground, at the community level, it is possible to break those silos and work together. Next is policy in action, how policies have influenced that kind of a convergence at the ground level and supported community work. A lot of examples there. And the last chapter, last theme is about especially vulnerable groups, children, adolescents, in which, of course, you also have played a part, right? Which brings me now to asking you people your questions. Let me first start with you, Mirai, since you've written that chapter on adolescents. What do you think works on the ground? What is it that needs to be done?
Thanks to both of you and for having made my work easier. I must say, as a public health worker, I always feel that nutrition is a big knotted ball of thread. You pull one thread out and think, oh, now you're making progress, unravel, there's more to it. But having said that, there are things that we can do and that we know work on the ground. And fortuitously, many of us have tried this. It's not just Seva. And one of them, of course, is early childhood, the first 1,000 days. Of course, it begins much before in the antenatal period, but for the purposes of our panel, I'll just focus on early childhood. And what we have found works, which has already been also mentioned by Dr. Pavitra, is creches. And these are creches not just for the first 1,000 days, but also up to 6 years old. And they are run by local women. They're run, in our case, by a cooperative, Sangini, which has been active now for 40 years, I must say. And what we have found is that it's not just nutrition. Of course, nutrition is very important. And here I would like to stress the importance of freshly hot cooked food. Many states are providing packets, including my own state, which we find quite frankly problematic. In our creches, the women themselves prepare the freshly hot cooked food and work out the menu along with the parents. Parents, no, not just the mothers, the fathers too. So work it out together. And of course, growth monitoring, which shows the result. And there have been several impact studies which have shown that children who come to us severely malnourished over a period of time, of course, it's a slow process and there are ups and downs as we know, and the nutrition and infection cycle we are all aware of. But still, the importance is that fresh, hot cooked food, but also a holistic approach. So it's not just pumping food into the child, but making sure that there's water and sanitation, clean water and sanitation as far as possible in the village, health and regular checkups, and also early childhood education and stimulation. The other important point, of course, is which is now well known, I think, and being studied more and more, is the connection with women's economic empowerment. And that it sets up a virtuous cycle. And what we've seen is when women are organized, one of the main things they need on their journey towards economic empowerment and self-reliance is early childhood care, is these creches. And of course, we've seen that incomes go up by at least 50%. Often they double. Often women who didn't work outside the home begin to work. And as I said, it sets up a virtuous cycle. And the first thing women say in our language, they say is, first we ate rotla and marcha, and now we can bring dal and vegetables and other better food into the home. So I think these are quick wins. Coming to quickly the adolescent collectives, which is what I wrote about, using Seva's organizing approach and building up membership-based organizations, solidarity organizations. We have set up several Yuva Mandals, both in urban and rural areas. And of course, we don't start bang straight in with nutrition, but we start with what's interesting to the young people, which is usually know your body, particularly changes in the body around adolescence, reproductive and sexual health. There, I must say, one of the learnings is that you must work with local women, who we call agivans, women leaders, and the parents, because some of these are sensitive issues. And then, of course, nutrition is integrated into it, particularly anemia. And what was particularly fun for the mandals was cooking together, recreating and reclaiming traditional recipes, millets, bajri, this and that, which, of course, many of us are doing, growing things, kitchen gardens, and so on and so forth. I think the important learning here is that it's not just about nutrition. It is that holistic approach. Whether we're talking about young children, whether we're talking about adolescents, they want to know about livelihood. Where can they go and study more? How can they be supported through counseling and so on? So it is that holistic approach. And we have seen also, just a quick one on hemoglobin and anemia, that for the first time, many of the young people, and by the way, some boys too, were tested for anemia. And they went, many of them, to the PHCs for the first time. So there was that important interface. And then, of course, we helped them open bank accounts and insurance. That's a separate issue. So it's the holistic again. But with the hemoglobin testing, and when they found that some of the girls and young women had and boys, very low hemoglobin, rather than leaving it up to that individual girl and saying, eat greens, do this, do that, the group supported. The group supported her, did follow-up and so on, tried to make sure also that girls remained in school and there wasn't early marriage and so on. So I think it's a whole sort of, as you've all said, multifactorial, a whole set of initiatives and interventions, but importantly, starting where people are, decentralized, local, and with women's leadership.
Thank you, Mirai. Very well put. In fact, it sounds very easy, but it must have been so difficult to put all that into practice. So hats off to you and all the others who do that. Which brings me to Vandana, who's been doing this kind of work also for a long time. And you've also written an article in the book on how you've worked and documented that work in the tribal areas. So for the benefit of our audience, please tell us what are the challenges and how do we overcome them?
Thanks. So, I mean, like I did say that the challenges are myriad and they are very different with different players in this whole business of policy formulation down to action. I'm going to start with the civil society space because it's more palatable perhaps. That, you know, the people who wrote into the book were exceptions. And mostly today in the NGO circuit or the civil society space, there are issues that are coming up even more now than before, which are limiting their ability to basically inform policy and to inform policy that can scale up in mainstream. I think the one thing is that people necessarily work in very limited ways, but without understanding that the positioning of that limited intervention in the larger scheme of things is very important. You may work in a limited way, but you must understand the larger scenario, which not all people working at grassroots do. The other thing is, I think, the conflation of working community-based work with placing all the responsibility upon communities, and especially the conflation with behavior change communication. I think this is very unfortunate, especially in the space of nutrition, that community-based work must be, as Mirai has explained, it has to be one of mobilization and empowerment. I don't think these days there's a lot of conversation or vision around what it means to empower communities, to demand, to understand, to be well-informed, technically well-informed. I mean, like, why should nutrition be considered rocket science? All of us eat food and all of us grow and develop. So I think these are the basic rights with which any intervention should be informed on the grassroots in the civil society space, which is not currently happening. More and more it's a case of implementation and not questioning either the system or the structure at all, and just doing just participating as an arm of the government within community. I don't consider that community-based work, and I also don't think that that's, has the potential to inform policy. At the other end, in the policy-making spaces, there is a shrinkage of space. I mean, we're sitting here in a very civilized group, but I think there is darkness for many of us in the struggles that we're facing in terms of the space for policy formulation. There is no formal space. We know, somebody said that one good headmaster can make the difference for a school. We know one good district magistrate can actually completely transform a district. But it's left to the intentions of this one person, and if they get transferred out, well, that's that. There are no formal spaces leave communities aside. There are no formal spaces for even civil society organizations, leave alone the actual people who are affected, and I think that's very important. So participation is very important. That needs to be housed in law, it needs to be housed in policy. Those spaces need to be protected for people to have a voice in policy making. Currently completely missing, and I think that's really a very, very major problem for us. Overall, I think the lack of data is one, the lack of rigorous data is another, the lack of acceptability of data is becoming a third. You know, that data can be very rigorous, can be very precise, and yet there is certain resistance, which we feel is a growing resistance to actually accepting what's happening on the ground as reality. These are our current challenges, and nutrition also has to face them. There's a reason why stunting has not gone down as dramatically as we would have wanted. I don't think changing standards is going to help us where it comes to the rights of women, children, and human beings who are suffering on the ground from lack of decent, high-quality food. So these are the challenges of the day. All of us need to gear up much, much more. But we do it with the hope and the faith that we're really here to make a difference. We're here to pledge our work and our commitment to make that difference, not just to find fault. That's not what we were ever about, and that's not the reason why we exist. The book is very positive and upbeat, and I hope that it will somehow make a difference. Over to you. Oh, it's, I think that we are drawing to conclusion. So let me invite Aarti to, she's been at the highest levels of policy making in government, and she's a public health professional. She sat in the Women and Child Development Ministry. She sat in the Health Ministry. I've had the privilege of working with her, somewhat with her in Odisha at the state government level. And she represents perhaps the best of what we can hope for, within the bureaucracy. What has been your experience? What do you think we can do better to work together to make a difference, Aarti?
Thank you. But then I'm glad you ended on a positive note, on that we shall overcome kind of spirit, which is right. When we look back at, contrary to what many people think, policymakers do look at evidence. They want good evidence. Sometimes that connect between good evidence on the ground and policymakers is lacking. In fact, most of the times. So in a way, this book partially bridges that gap. But what is important for us is to understand, and this transfers and things is something that does happen in bureaucracy. What is important for us is to look at sustainable interventions. And many of the interventions that are there in the book, in the policy making chapter theme, are the sustainable interventions because they are rooted in community action. The subtext of our volume is connecting the dots through community action. And I think if you were to look at the cover of our book, which is on the left, the book basically captures the essence of putting this person at the center of action, whether it is the community organizations, whether it is the academics, whether it is the policymakers. We understand that at the heart of it lies that all of us are working with the same purpose. We all want to improve things. We do it in our different ways. For the policymakers, the heft is probably greater, the ability to make a difference is probably more, but that does not in any way undermine. Rather, I would think that this 1,000 flowers blooming is a very good thing for our country because we have so many contexts. Each district is different from the other. So learning from these inputs from the ground is something that I think we, not just in the case of nutrition, but in other cases also, is something we need to ground now, in a much better way. What is that single source of truth? Because even for a policymaker, 10 people will come and tell you 10 different things. Which of those things is going to have the biggest bang for the buck, biggest traction? So that is something that we now need to institutionalize. And I think at the end of it, if we put that woman and her child and that household in the center, we realize that there is no way other than convergent action. You have to connect the dots if we have to overcome. So I think that's the message also that this book tells us.
Can I just add one thing? I think if there's one thing we've learned, and this is not just true for nutrition, for health, for education, is the importance of decentralized action. The solutions come from people. As you said, there are many different contexts. One size doesn't fit all. Of course, there's some common themes, and as you said, starting with people at the center, particularly the poorest and the most vulnerable, who in our country are informal women workers, Dalits, Adivasis, as we've been hearing, migrant workers, since this morning we've been hearing. But I would also like to add that, partnerships. For example, our state for a long time had entrusted the running of ICDS, in fact 100 centers, to the cooperative. And that not only built women's livelihoods and made them feel empowered and brought food into their own homes, but also, they provided quality care. They made sure the nutrition was of quality, proper quality and quantity. So I think these are things, experiments that perhaps other state governments and, well, others in general could go for. I also wanted to just add that I think there are a few challenges. We want to end on a positive note, but we have to be realistic. And I think the challenge of obesity, which is coming up. I live in a state where, particularly in urban areas, there are growing. I see even in the last 50 years, our members who are working class, informal workers, how their health and, has changed, their weight has changed, and so on and so forth. So that's one thing. I think elderly people, we're focused a lot on children and women and younger people, but what about the elderly? As has been mentioned, it's an aging population, yeah. And disabilities. And I think one thing that I've seen again and again, and particularly in the tribal areas where we work, bordering Rajasthan, is that those rehabilitation centers, now they have a big new name. What women say is that we can't afford to take our child there and keep the child there for 10 days or go back and forth. We have cattle, we have other children, we have work in the field and so on. So can we think also of community-based ways, and I know there are, and there are in the book as well, so that children don't have to go to a center far away. And instead, you know, the idea that combating malnutrition is everybody's responsibility, all families' responsibility at the local level. And there's surely lots of things we can do, like creches. So I'll stop here.
I think our time is up, and that's our panel.
Thank you. A huge round of applause for the panel. Thank you to the panelists for walking us through the content of the chapters and for highlighting the key issues which have been discussed in the nutrition volume. I now invite Dr. Arushi Jain to please be on the stage and felicitate our panelists.
It's a nice all-women stage today.
Can we please have the group photograph? Thank you, everyone. Ladies and gentlemen, we now transition to a special segment of the program, the distinguished panel featuring eminent thinkers whose work has shaped public policy, development practice, and institutional reform in India. The discussion will reflect on themes that cut across 3 volumes presented so far: education, healthcare, and nutrition. I now invite our distinguished speakers to kindly join us on stage. Please welcome Professor Deepak Nayyar. Professor Deepak Nayyar is an emeritus professor of economics at Jawaharlal Nehru University and honorary fellow of Balliol College, Oxford. A former vice chancellor of the University of Delhi, he taught at Oxford, IIM Calcutta, and the New School. Professor Nayyar served as Chief Economic Advisor to the Government of India and Secretary, Ministry of Finance. Okay. He'll just be joining us in 2 minutes. I also please welcome Dr. Sekhar Bonu. Dr. Sekhar Bonu is a senior fellow at Niti Aayog and former Director General of its Development Monitoring and Evaluation Office. Previously with the Asian Development Bank, he worked on health, urban infrastructure development, and regional cooperation in South Asia. A former IAS officer in Rajasthan, Dr. Bonu holds a PhD from Johns Hopkins University and is a CFA charter holder. Please welcome Professor Deepak Nayyar. Please welcome Mr. Amarjeet Sinha as our third panelist. Mr. Sinha is a retired IAS officer and senior fellow at the Center for Social and Economic Progress, former Secretary, Department of Rural Development, and advisor to the Prime Minister. He was a key architect of Sarva Shiksha Abhiyan and the National Rural Health Mission. Mr. Sinha is an author, teacher, and reform leader with over 4 decades of experience advancing inclusive human development, poverty reduction, and last-mile governance in India. With this, I now hand over the session to the distinguished panel for the discussion.
Respected Professor Deepak Nayyar, dear friend Shekhar Bonu. We come to the last session pre-lunch, and just before we actually release the 3 volumes, we wanted our experts to comment on what has gone on since morning. And just to further explain and add to why the 6 books appear together, we found it very difficult to separate where one ends and the other begins. The human development sector, we wanted to get away from a compartmentalized perspective, which has often been the bane, where we want it to end here. And to quote Dr. Srinath Reddy, who famously talked about the health ministry, and he said that almost every minister in a cabinet is a health minister in some way or the other. Whether somebody is looking at industry, pollution, whichever sector you're looking at, but you are actually a health minister. Given this interconnectedness of the sector, we really felt that we needed to understand the issues at the cutting edge better. The second thing that was in our minds, and largely because many of us who both do field work and dabble in academic work, we felt that there was a gap that we needed to address. And that gap was one about a volume that actually builds on the perspectives of a range of players, academics, activists, policy makers, civil society professionals, practitioners. Is it possible to have all of them come together, try and first capture the experiential learning, subject it to as much rigorous academic scrutiny as possible, and then to see what is the form in which we take it forward? I only recall one process, and Anjal is here. Thanks to Anjal, we followed this process for all the volumes. Very interesting one. If there were 20 authors in a volume, he would make us sit in 5 different groups of 4 each, or 4 groups of 5 each, and all from diverse backgrounds, somebody an academic, somebody an activist, somebody else a public policy maker. And then one of the authors had to present briefly the points in their paper in about 10 minutes. All the others from diverse backgrounds would comment on it. If an academic author was presenting, he got a feedback from somebody, a civil society professional, who would contest some of the points that were being made, or the other way around. So through this very interesting process of what Anjal prefers to call a knowledge cafe, some of these volumes grew out of this process. Friends, it's a privilege for us to have Shekhar Bonu with us, Professor Deepak Nair with us, to guide us through their assessments of whatever they have seen of this work, and also to share a more forward-looking future years, these sectors and what it holds for India. Suffice to say that more and more that we dabbled into a lot of contemporary economic publications on India, from Arvind Modi to Arvind Subramaniam and so on. In all of them, we must say that 2 issues always get highlighted. One, the fact that on human capital, we need to do better than what we are doing so far. And if at all we want to move on to that level of 9 or 10% economic progress, it is inconceivable without an equal effort on human capability and human capital of an order that allows us to move forward at that pace. The second issue that gets flagged in a lot of these studies is the challenge of collaborative governance. Collaborative governance as thought through Ansel and Gash or through Elinor Ostrom, where non-state actors actually have a consensual decision-making role. Have we provided space for consensual decision-making role to non-state actors? And if not, is that compromising the outcomes that we are looking for in primary schools, health centers, Anganwadi centers, and so on? These 2 concerns on human capital and collaborative governance have informed the papers, the 102 chapters that you will go through. Each of them have elements of collaborative governance, decentralized community action, as also the challenge of human capital and the interconnectedness of these sectors. With these words, I first invite Shekhar Bonu for his comments, and thereafter Professor Deepak Nair. Shekhar.
Distinguished editors, authors, and guests here, good afternoon. I feel very privileged to be here at this very, very important occasion. Though I have been asked to speak about, I'm broadly speaking about healthcare for all, community action and public policy and inclusive India. But before that, I also want to touch upon the 6 volumes. I have been, for initial 10 years, a civil servant practitioner in the field. Later on, I struggled with a PhD and wanted to publish in peer-reviewed journals, got rejected, and so forth. So this struggle, this knowledge at the bottom, mostly tacit knowledge, and then this academic rigor and publication and credibility at the top. And somewhere the research has slowly biased towards what is researchable, where you have enough data and you can generate very good econometric models and so forth, and RCT and experimental. But there's huge amount of knowledge which is not amenable to that type of research. There are too many variables, and these variables are interacting in a known and unknown manner. And that's what happens in the field. So it's about, and in case of India, it is a lot more complex and a lot more homogeneous Western societies from where we get most of our theoretical understanding. So in this particular context where you are building this tacit knowledge, and you know there is some clarity, but there's a lot of lack of clarity. And we studied these through case studies, and even in Harvard Business School, the Makkah of capitalism, the case studies are very important ways of teaching. In case of India, I felt most of this tacit knowledge among practitioners remain below. And there are some aspects which are researchable, which can be done through RCT and experimental or quasi-experimental water that gets overpublished. So there's a bias. So there is this very important knowledge that needs to be brought to the public front, which you can only capture through case studies, and which is through a rigorous means, but it will help you to move towards the frontier in small steps to clarify. But somehow, given the silos in which practitioners and academics operate, somehow it doesn't happen. And I really, first of all, want to congratulate and appreciate Bharti School for Public Policy for taking up this task. It's of incredible use, because if we haven't done this, I think most of this knowledge will remain tacit, and we are struggling in low equilibrium where everyone is reinventing the same thing. So now with these volumes, I think we are documenting, we are clarifying, we are making little bit inroads into that clarity on what works, what doesn't work, in a complex institutional capacity building, culture, sociological, anthropological, multidisciplinary setting. So first I would, and in that whole course, looking forward, I think we should do a lot more. Ultimately, each case study will be a N in that number in statistical terms. And more we get, I think more robust we will build our evidence. So now coming back to the health volume itself, I think this is extremely timely. We are planning to go towards developed country by 2047. And when you look at the developed countries itself, you have US, which spends around 18%, 15 to 18% of its GDP with very, very low health outcomes compared to Japan or others. So it's not throwing money, it's also about how do you use money. And clearly, East Asia, whether it is Japan, Korea, Thailand, it clearly shows that you can't ignore primary health care. You can't ignore keeping people at the center. So what has happened in the last 6 decades is, 6 or 7 decades, is that we haven't done that well on primary health care. We built structures, but that critical wheels part, somehow I think we have missed. And now we want to blame public health care, and we want to pivot to market-driven solutions where there is clear market failures, and in case of health, it is even more larger failure because of information asymmetry. So we are now trying to say that this has failed, and now we will come up with a jumbo jet, Boeing type of solution, which is only, it is only going to lead to unmitigated disaster, where we'll spend a lot more with much lower health outcomes and a lot more inequality. So clearly, what is it that can make primary health care work? Because there's no substitute for public government's role in delivering public good, especially public health care. So I think this book really provides the processes that make institutions work. It's not about outcomes, it's about the roadmap towards that outcome. And if you carefully look at it over this volume, over 6 volumes, I think we will gain a lot more wisdom on what can work in this complex institutional setting. And for me, I always felt, how did India come up with ASHA? This is the connect between the community and the front-end functionary, health, the government servant. I feel government servant, even if it's a health worker, is an elite compared to extremely vulnerable migrant. So there's so much of disconnect at the last mile, and ASHA has made it happen. But it's not a routine program. It was very, very well thought through in Chhattisgarh, and then it was implemented at a scale, bringing the pathways carefully thought through. But again, it's possible that there can be regression back to normal. So I think there are plenty of such deep experiences of practice which has been documented with reasonable academic rigor, not to the RCT level, because it's just not possible. Let's accept it. There are limitations, but it is very important to move in that direction. And looking forward, I mean, I can go on, but I have to stop here. Looking forward, I think this is probably the first step. We need to do a lot more, have compendium of huge number of case studies that are available, searchable and available, not in book format, but also thematically. And hopefully it will lead to some more toolkits for practitioners, and support to academies, support to pre-service and in-service training, because ultimately this have to become part of DNA of Indian civil services. And hopefully it will happen. And once again, I want to congratulate the editors, authors, and also for audience for going through my talk. Thank you.
Good afternoon, colleagues. This morning has been a learning experience for me. I have not had the opportunity to read the studies so far, but I have a sense of what this is about. I'd like to thank Amarjit for this invitation to speak, but I'm surprised. This is not my domain. I have spent much of my professional life doing macroeconomics and international economics, although for the past 15 years, I have also been engaged in issues around human development and employment. You know, economists have a very bad habit. If they don't know the answers, they change the questions. Now, I'm not going to do that. But I'm going to try and view these micro studies on human development from my macroeconomic perspective of human development. In a sense, you have approached the problem from below. I have attempted to analyze the problem from above. But I do believe that these micro-studies in human development, I have not seen anything like this before, are a very valuable contribution to our understanding and knowledge of human development. Now, if I wish to view this from the lens of my macroeconomic perspective, I'd like to begin with two simple propositions. First, in the conventional discourse on macroeconomics, human development is at best marginal and at worst irrelevant. Go to any Ministry of Finance, that's the sense you'll get. In the unconventional discourse on human development, macroeconomics or its constraints are seldom recognized, even if its consequences are often highlighted for human development. Now, there is an irony in this situation that is striking when you compare it with ideas from the past or juxtapose it with experience from the present. The ideas that economic growth at the macro level is ultimately about well-being of people at a micro level, or that investment in people, say in the form of education, health, or nutrition, supports productivity increase and wealth creation in the economy. This idea has a very distinguished lineage in economics. For Adam Smith, the wealth created by labor in every nation provided the necessities and conveniences of life to people, while the education of people was clearly an important source of the wealth of nations. In other words, even if not stated in an explicit manner, in Adam Smith's thinking 250 years ago, there was some implied connection between the wealth of nations and the well-being of people. My profession of economics has lost that connection. The second proposition is that what I've just said is also borne out by the experience of countries in Asia, which were latecomers to industrialization during the past 50 years, say from 1975 to 2025. The spread of education in society and the provision of health care for people was at the foundation of developments in countries that were success stories. Rising incomes per capita and improving social indicators, say life expectancy or literacy rates, were related closely to each other, and the causation ran in both directions. The well-being of people is crucial because it is both constitutive of and instrumental in development. I borrow from Amartya Sen. Now, in other words, human development is both ends, the well-being of people, and means to development. Thus, social progress for people and economic development for countries together can reinforce each other in a virtuous circle. But unequal opportunities and unequal outcomes together can accentuate each other over time, making matters worse both for the well-being of people and for the development of nations. So if we look at East Asia, it's an example of a virtuous circle. If we look at South Asia, including India, it's an example of that vicious circle. Now, let me come to exploit my comparative advantage. How do we connect macroeconomics, the kind of big picture, with human development, the micro-studies? What shapes the lives and well-being of people? In mainstream economics, the intersection between macroeconomics and human development has diminished with the passage of time. So in drawing attention to that, I am the outlier who has always been an outlier. The concerns of macroeconomics have become narrower as the focus has shifted from full employment to price stability, from growth to equilibrium, from the long term to the short term, and from the real economy to the financial sector. The conception of development, on the other hand, in sharp contrast, has become wider, much wider, starting from just economic growth or increases in per capita income to freedoms associated with rights, capabilities, and opportunities for people. The consequence of changing concerns and shifting emphases is that the connections between the two do not receive sufficient recognition, let alone attention. Now, there is a strong connect that is seldom seen above the surface. Macroeconomics matters for human development because it determines the level of employment, the degree of social protection, and the public provision of services such as healthcare and education. The consequences may or indeed will be positive where macroeconomic policies pursue full employment, strengthen social protection, provide resources for public entitlements and such as health and education, and are conducive to economic growth in the long term. The consequences may be, indeed, are negative, where macroeconomic policies focus on price stability alone. And this is what ministries of finance and central banks do everywhere. Nothing else, price stability. Dilute social protection, which is happening everywhere. Cut public expenditure on social sectors because there are no political constituencies. Such policies now in fashion everywhere, not just in India, even in the United States, where risk has been privatized, where social protection has been diluted, have negative consequences for the poor, the marginalized, and the vulnerable. Human development, at the same time, has implications and consequences for macroeconomics. For it can mobilize or claim resources to enlarge or to diminish the space for macroeconomic policies. Now, in developing countries with surplus labor, human development can enlarge macroeconomic policy space, essentially through a mobilization of and creation of resources, real rather than financial, provided matching employment opportunities are created. Now, that is critical. If the outcome is jobless growth or human development claims more resources than it creates, there is also a negative causation that runs from human development to macroeconomics. I wish the orthodox economists and politicians that run ministries of finance and central banks understood this. They don't. Now, let me explain. In most developing countries, which are capital scarce, there is surplus labor that is underemployed, irrespective of the endowment of land or natural resources. Hence, their most abundant resource, labor, is underutilized. Now, there is no better example than India. People are our most abundant resource, yet people are grossly underutilized. In such countries, macroeconomics is, or at least should be, in part, about mobilizing and creating resources, not only financial resources, but also real resources for development. Now, human development which imparts capabilities to people, and that is what all of you have been engaged with, can both mobilize and create resources. In a sense, they provide solutions to problems that ministries of finance face everywhere. it constitutes resource mobilization, human development, beyond financial resources, which are the usual concern of macroeconomics, insofar as it mobilizes the most abundant, yet most underutilized resource, people, for development. The absorption of surplus labor in employment, then, is an important source of economic growth. It constitutes resource creation insofar as it increases the productivity of labor for any given level of technological development, introducing another source of economic growth. The same people who constitute resources on the supply side also provide markets on the demand side, and that's what feeds a virtuous circle. Now, this causation is possible, but neither automatic nor assured. It will not materialize if employment opportunities are not created or not sufficient. Now, I know that time and patience are both exhaustible resources. I don't want to stand between you and lunch. But let me conclude very briefly, and in so doing, my own conclusion and a response to Amarjit's questions at the outset. Now, the design of macroeconomic policies is influenced by constraints embedded in the polity, while the quest for policies that promote human development is also influenced by political compulsions. Macroeconomic policies everywhere are shaped by interests, ideologies, and institutions taken together. There is, however, one interesting twist in the tale. For those who are excluded by the economics of markets, where 1 rupee is 1 vote, are included by the politics of democracy, where 1 person has 1 vote. This reality provides some access for human development into the political process, more often in rhetoric than in substance. All right? Take the examples that are most cited. Bolsa Familia in Brazil, or the Mahatma Gandhi Rural Employment Guarantee Act in India, which is now being diluted through a legislation so that it will not be what it was meant to be. But even when there is substance, as there was in the Bolsa Familia, as there was in the MNREGA until now, the problem is that transfer payments in perpetuity, that you support minimum needs, essentially in terms of food, by transfer payments through such schemes. But you do nothing or very little to make public provision for education and healthcare that provides at least minimum quality. That's the difference between us in India and the success stories of South Asia, all of whom had literacy rates, infant mortality rates, life expectancy lower than India in 1947. But they all attained 100% literacy a quarter century ago. India has still miles to go in this respect. Now, the moral of my story is that supporting the private consumption of the poor is important where the incidence of poverty is high. But it is amelioration. It is addressing the problem of poverty at the time, but it is not resolving the problem of poverty. Now, you need to do 2 things. A, you need to make public provision of education and healthcare that is acceptable and respectable both, which we have notoriously failed to do in terms of public provision. And B, you need to actually use macroeconomic policies that are employment friendly, that actually end up creating employment. Because employment and livelihoods are the only sustainable means of eradicating poverty, of not eliminating, that is impossible, but mitigating inequality. And therefore, I think we need to bring our concerns about human development together with our concerns about our failure to make public provision for education and health care, which is grossly inadequate, just as we need to stress in the political sphere the importance of creating employment. So this is my endeavor to connect your world with my world. Yeah? I do think that what you have done is invaluable. But how is it that what people in communications call, how can we create an impact with this research that we have done? Now, I have an association with the Institute of Development Studies at Sussex, which actually translates the research it does, and it does quite a lot of participatory research, into public action, or into helping facilitate public action. Now, it seems to be, and you have brought together a group of persons from civil society engaged with these domains, nutritional outcomes, learning outcomes, institutions, healthcare for all, climate. So you have a group of those drawn from civil society, those drawn from policy practitioners, and those drawn from academics. These twain seldom meet. You have brought them together. Now, I think I'm trying to respond to your question, impromptu. I have not thought about it, so it is thinking aloud. First, I think, 6 sort of magnum opuses which are micro-studies in human development will not be read by anyone who does not have time. Therefore, you should do 2 things, I believe. One, you should produce a short executive summary of all these volumes. Not so much in terms of analysis and diagnosis, but focus on prescription. Yeah? Or learning. Where did we go wrong? How can we get it right? At the same time, this might actually even be read by people in my profession, who are economists, live in a very narrow, mainstream economists live in a very narrow world. There are some who are different, but they would be concerned with this anyway. But at the same time, I think you would need to do what communications people call a policy brief. So if you're going to use this wealth of knowledge you've created to actually make a difference, then you have to translate it into a length and in a language that is going to be easily understood by policy practitioners. I don't mean that policy prescriptions don't have the abilities. It's just that they don't have the time. And you need to convey bottom lines much more clearly. So the 2 things I would suggest: an executive summary for readers, a kind of policy brief for governments, state and center alike. And I believe also you could be writing some op-eds in national newspapers, in local language newspapers, because they are much more widely read. And that could help create at least some consciousness. I think we have made progress in independent India, but my sense is that we have miles to go. And my sense is that our political leadership is not even cognizant of that reality. It is about freebies at election time. It's not about creating education systems that are public, healthcare systems that are in terms of public provision. So that is what we need to push for, and I think that if you did these three things together, the impact of the studies you have done could be that much larger. Thank you for listening.
So I just wanted to share, sir. In fact, there is a next phase to this study, an executive summary, policy briefs, videos we have proposed over the next 18 months to reach out, and as also a lot of regional consultations in universities and with state governments is part of the proposal that we are working on now.
Thank you to the esteemed panelists for sharing their thoughtful reflections and suggestions for the way forward of these volumes. May I please invite Professor Anjal Prakash to please be on stage and felicitate the panelists. Can we have a huge round of applause? I request the distinguished panel to please be on the stage for the official launch of the first 3 volumes. I also request the editors of the 3 volumes, Education, Healthcare and Nutrition, to please join us on the stage for the launch. I also request the series editors, Professor Anjal Prakash and Dr. Arushi Jain, to please join us for the launch. I'm also delighted to invite Shoma from Routledge to please join us on the launch for the launch of the 3 volumes. I also request the authors of these 3 volumes to please join us on the stage for the launch ceremony. Ladies and gentlemen, this has been a collaborative journey of 2 years, bringing together academicians, practitioners, policymakers, and civil society professionals through a structured process of workshops, dialogues, peer reviews, and collective reflection. Can we please have a huge round of applause for the entire team of the 3 volumes, Healthcare, Education and Nutrition. A huge round of applause for the volume editors, authors, and contributors for their extraordinary work over the past 2 years. Thank you, everyone. I now invite Dr. Arushi Jain, Policy Director and Head, Government Affairs, Bharti Institute of Public Policy, Indian School of Business, to kindly deliver the closing remarks and vote of thanks for the first half of today's program.
Just pick my mobile thing and lift it here. Is this yours?
Mine, yes.
And should we keep these?
We should meet up again.
Over to you.
And my wife's with me. Mirai, how are you?
Good, good. I saw you and thank you for your remarks. I love the way you link macro and very nice.
That's how I came to human development.
I know.
And a voice in the wilderness. Most people.
But, you know, I think we need
Yep. Yep.
A very good afternoon, everyone. After such amazing and enriching discussions, I actually don't want to be between you and lunch. So I'll be brief here in my closing remarks and the vote of thanks. As we come to the close of this morning's session, we formally mark the launch of the first 3 volumes out of the 6 in the series, and we will be launching the other 3 towards the evening today. I would like to just very briefly try and reflect on the discussions that we had around the 3 volumes. And over the last few hours, we've heard some of the most enriching discussions and eminent speakers engaging deeply on the most critical aspects of human development, touching upon public policy aspects, to community action, to collaborative governance, and many of those aspects that practitioners actually see on the ground on a daily basis. When we had, the very initial discussions when Amarjeet sir had discussed about coming out with these human development volumes, this seemed to be a very tough task. And how to think about, maybe 200 chapters, 192 authors coming up with hundreds of chapters being compiled in the 6 books. It was a process that was taken up over a 2-year period, and thankfully today we are here, in a way, a culmination where we are launching these books. As Mr. Sinha just spoke about it, that we are not just stopping by launching these books. The idea is to take these books forward, and we will be having the next whole year spent on propagation of the micro-studies that have been captured in these volumes at different levels. So there will be regional workshops, there will be articles that will be coming out of these volumes, not just in English, but in vernacular languages, which may include Marathi, Telugu, Tamil, and so on and so forth. We will be coming out with news articles, we will be coming out with policy briefs and documents. We are also planning to capture some of these outcomes in terms of case studies, which will be multimedia case studies available for policy students across the country and across the globe to know and learn about what happens in India and how various human development efforts are going on in the country. So in today's discussions, the very first panel discussed about our first book, The Improving Learning Outcomes in Schools, and the volume discussed about teachers' empowerment and capacity, school leadership and management, assessment and evaluations, the use of data, which is really important to measure performance, and so on. The second discussion that we had around healthcare for all focused on universal healthcare, from policy to action, for various themes around knowledge management, unemployment, migration, talking about mental health, health workforce, and various diverse issues that impact community action in healthcare. The Improving Nutritional Outcomes volume also speaks about the farm to the fork approach, the health and nutrition, women collectives and action, empowering communities and behavior change discussions, reflecting an integrated and
holistic approach. I think the underlying context in all of these is communities and collaboration that comes up as a theme overall. I would like to place on record my sincere thanks to all the editors and authors of these volumes. Grateful to our speakers today, Dr. N.V. Varghese, Ms. Vrinda Swaroop, Dr. Rukmani Banerjee, Dr. K. Srinath Reddy, Dr. Pavitra Mohan, Dr. T. Sundaraman, Ms. Aarti Ahuja, Dr. Vandra Prasad, and Ms. Mirai Chatterjee for such thoughtful perspectives that they shared today. A special vote of thanks to our distinguished panelists, Dr. Shekhar Bonu and Professor Deepak Nair, for joining us today and for such enriching discussion and the way they kind of linked their work to what we have brought out in these volumes was truly enriching and commendable. Their reflections added depth and context to the themes explored in these volumes. I would like to acknowledge in particular the efforts of Mr. Amarjit Sinha, whose vision and leadership has been central not just in conceptualizing of these volumes, but also in the development of all the 6 volumes in the series. I'm truly grateful to the vision of Professor Ashwini Chhatre, who could not join us today, and Dr. Anjal Prakash, the series editors of our public policy series at ISP, for the vision, commitment, and all the work that has gone behind this ambitious work. As organizers, we are grateful to all the contributors, the collaborators, and the partners, and especially a huge thanks to the Gates Foundation for supporting the platform for developmental research and communication, the PDRC initiative at ISP, for anchoring this work, and for Routledge for publishing these volumes. My sincere thanks to the entire team that has worked on these volumes, especially to our researchers who actually were the anchors, tying up on all sides with the authors, with the editors, with the copy editors while they were editing and working on all these volumes with the different practitioners and academics at parallel. Finally, a huge thanks to our audience today. It's not easy to sit through 4 consecutive sessions. So thank you so much for doing this. But please remember, we are just at the half. We have another half post-lunch, and we will like to have you back for equally and even more enriching discussions in the next half. So thank you so much. Let's proceed for lunch in the lawns.
Afternoon. On behalf of the Bharti Institute of Public Policy at the Indian School of Business, I, Nimisha Jain, Research Manager, have the privilege of guiding you through today's proceedings. Today's event marks the launch of 6 volumes of Micro-Studies in Human Development, part of the Bharti Institute of Public Policy's flagship book series with Routledge titled Innovations, Practice and the Future of Public Policy in India. The first half of the day focused on 3 volumes addressing education, healthcare, and nutrition. In the second half, we turn our attention to the remaining 3 volumes, which explore rural livelihoods, climate action, and institutional pathways to social development, themes that are deeply interconnected and central to India's development trajectory. To formally open the second half of today's program, it is my privilege to invite Mr. Amarjeet Sinha, a guiding force behind this body of work, to deliver the opening remarks. Can we have a huge round of applause for Mr. Sinha, please?
Dear friends, after an absorbing forenoon session, we now come to the 3 other volumes that are a part of the series, though it's very difficult to make a distinction between the 2 sessions. But for this session, we had put together the livelihoods, the climate action, and the reimagining institutions volumes for release, primarily because education, health, and nutrition by themselves became one full set of 3 volumes. Friends, the thought behind this process has already been explained, and I would not like to take much of your time, except to say that in these 3 volumes as well, as the panels will bring before you, the intent is to understand the challenges from perspectives of local communities. The intent is to see where things have worked and where they have not worked well, to see what is it that is likely to make a difference. And again, whether it is changing tides, whether we are looking at climate action, whether it is reimagining institutions, which institutions have delivered, which have not, what are the challenges, what is it that we can do differently. A whole lot of issues in the context of different states has been raised. In all the 3 volumes, you will find a very large number of specific case studies pertaining to works of civil society organizations or in different parts of the country. In the volume on climate action, for example, a lot of the mitigation measures in many programs and how local communities have come forward on mitigation measures, some of those issues we'll discuss. I would not like to come in the way of the panel discussions, which have to start now. Suffice to say that all the 6 volumes, for us, this distinction is purely mechanical and for convenience. We had a lunch break in between, but all the 6 volumes are connected to each other. I congratulate the volume editors of the 3 volumes that are going to be released in the afternoon, and also all the authors who are here, because a lot of thought has gone into these 3 volumes from a perspective of a wholesome presentation of the challenges of the sector, as also some of the learnings from what has been attempted so far. Thank you so much for your attention.
Thank you, Mr. Sinha. Ladies and gentlemen, we now begin with the 4th panel of the day, based on the volume titled Pathways to Rural Prosperity, Livelihood Interventions and Transformation in India. Edited by Mr. Ved Arya, Ms. Ayushi Balutia, Professor Ashwani Chhatre, and Dr. Nivedita Narayan, this volume brings together 15 chapters by 27 contributors, capturing India's rural transformation through innovation, community resilience, and evidence-based livelihood strategies. I'm pleased to invite our panelists on the stage, please. Please welcome Mr. Ved Arya, Mr. Ved Arya is a social development entrepreneur and author who has founded transformative organizations advancing rural livelihoods and poverty alleviation in India. An IIT Kanpur and IIM Ahmedabad alum, he founded Srijan, the Buddha Fellowship Program, and Srijan Infratech and Development Services. Mr. Arya is a Humphrey, UNEP, Ashoka, and Aspire Fellow, and a recipient of the Schwab Foundation Award. Please welcome Mr. Saroj Mahapatra. Mr. Saroj Mahapatra is the Executive Director of Professional Assistance for Development Action, leading its work across India's poorest states to strengthen sustainable rural livelihoods. With over 28 years of experience, he has guided major government and multilateral projects, advanced climate-resilient natural resource management, and contributed to key state and national committees shaping inclusive, community-driven development. Please welcome the third panelist, Dr. Nivedita Narayan. Dr. Nivedita Narayan is a pioneering development practitioner whose 35-year career spans transformative work in gender, livelihoods, and strengthening institutions across India. Currently, Senior Research Advisor at Transform Rural India and adjunct faculty at IIT Delhi, she has previously led Charities Aid Foundation India and spent over 3 decades with Pradhan, pioneering India's earliest self-help groups and advancing research, teaching, and advocacy in development practice. I now hand over the session to the panel.
Thank you very much. We are a bit of a Swayambhu panel like the rest, and we have organized ourselves. We're also all Pradhan colleagues, so that's wonderful and lovely to be here with all our colleagues and our authors of our volume. We're going to begin with what we think the book contributes in the contemporary landscape. We have a bit of debate about whether to make it more personal or not. So we're going to do 2 rounds very quickly, so we can each choose. But I think I'm going to start by looking at 5 shifts that this book really brings about, this volume. And it moves the conversation to prosperity, well-being, both ecological and community well-being. So I think that is a big shift that this book makes from poverty alleviation and livelihoods. It also looks at a strategic division of financial labor between governments, the private sector, and philanthropic organizations quite squarely in the face. So one, I'll go very quickly and also introduce the chapters that I thought were particularly of interest as you read this book, which I hope you will, or other readers will. It moves from a fragmented generic poverty alleviation model that's a template but not particularly connected to local realities, to a context-specific strategy, set of strategies that are built around very specific resources and communities. So for example, the PVTGs in Odisha, that's chapter 3, or Bihar's Jivika, the SJY program particularly, or place-based approaches in chapter 12, which is and weather adaptation in chapter 13. So it looks at adaptive strategies. So these are very important, I think, for those interested. A second very big shift relies on descriptive stories or anecdotes. So earlier there was a lot of descriptive case studies, stories, anecdotes, but without proof of impact or proof of change. So this one has solid empirical analysis. Each chapter has solid empirical analysis, data from the field, and it also builds a smarter how-to guide, which is quite important for us to learn from. And we start, for example, chapter 3 talks about the marginalized but dietary diversity evidence. And then there's the longitudinal field data from the NRLM chapter. And the Buddha Institute chapter, which talks about statistical evidence. It actually provides statistics. Or the Bundelkhand initiative, which gives NGO practice evidence from 6 NGOs in comparison. And then a paper which me and my author here, Satya, have done, which is around ecological livelihoods, where we have historical as well as field analysis and a lot of data. The third one is on systemic vulnerabilities. Typically, most books, I would say, and I'm putting my neck out here, would have over-reliance on rain-fed agriculture that leaves families at risk, but doesn't talk about other aspects. Whereas here we are talking about ecological livelihood diversification, sustainable entrepreneurship that can drive resilient economic growth and protect the environment. So that is a big shift in a book. And the mega watershed, there are others, the farmer mega watershed, the farmer producer companies, the Adivasi communities, Keystone Foundation, biodiversity work, and the ecological tussar work. These give good examples for anybody interested in this. I'll quickly go through the generic approaches falling short because of the unique struggles of particular communities, the ultra-poor, for example, and the PVTGs. So we have the graduation approach here, a clearer graduation tailored roadmap. We have the graduation approach for the ultra-poor, the PVTGs, the particularly vulnerable tribal groups, what it might take to work with them, and mobilization of women with the NRLM. So there are 5 or 7 chapters that actually focus on this. And using, the most important I would like to highlight just now is using siloed budgets to, and it leads to uncoordinated work, wasted resources, and there is very little support to NGOs for their own development and institution strengthening. Whereas this book actually leads more into that. It shows how you can bring public and private investments to fund these pathways. And each chapter actually shows a more innovative way, and I'll save my discussion on this for the end. So thank you very much. I'd like to invite Saroj now. What did you take away, Saroj, as the contribution to the country?
Thanks, Nivedita. First, I would like to give thanks to ISP and Bharti Institute of Public Policy, and obviously Mr. Amarjit Sinha for guiding us and mentoring us for the entire volume. And it was a very good learning experience for all of us. And as an author of this, one of the chapter, because this book talks about many aspects, like starting with the program like NRLM, the Inclusive Livelihood Programs, plus working with PBTGs, plus how this convergence can take place in a very large scale, and the community institutions at large, and obviously the ecological aspect also. So multiple diverse perspectives are there. And for me, I think there are 4 or 5 points which I would like to highlight. One part is, while writing, I realized that, and with the Pradhan's last 40 years of experience, so we need to work around a very big idea and the larger purpose actually. So when the purpose and the intent and actions are in alignment, then success will definitely come. Obviously, there will be failures, but we need to learn from the failures also. And second is, when what Mirai was talking in the first up session, like the decentralized community actions, and if we take the perspective of the people into the forefront, I mean, when the programs are designed, taking into considerations the community's priorities, at the same time the priorities of the state and the national government, and at the same time what are the other ecosystem players like the civil society organizations and the CBOs, then that is going to be a success. And in this, there are many articles in the book, and which I and Manoj, my colleague, wrote about how to secure livelihoods in the rural areas. And the convergence could be a very good mechanism, and communities' priorities can be the first principle of process of planning. And second, learning is actually the building people and the community institutions are the very critical for any program to sustain, whether that is education, whether that is health, or whether that is livelihoods. So in that sense, the pathways to prosperity, the title of this entire book actually. So when we are talking only about wages, so wages are the basic critical needs, but beyond wages, like how to convert these wages to asset creation, then markets, and there are many ecosystem players, plus this how to, promote livelihoods in a very resilient manner so that it is sustainable. And livelihoods, it's not about the income actually, it's all about income, asset creation, then building the capabilities of the people, plus how to make this more sustainable and resilient. So all those learnings are there in our chapters. And third point I would like to highlight is how to bring targeted investments for the most needy people. So there are many examples in the book like the PVTG's program or the how to leverage the programs like NRLM and MGNRGS. Now the name, there are issues in the name, but I think most of the learnings were around those. And while doing the, the Ved and Nivedita and Ashwini, so they were the editors. So we see like many times we look only at income or the asset creation, but there are many factors like what is the people level outcome, and which are very critical, like the knowledge and practices level, what are the changes, what is their income level, what is the change in the asset level, and what are the changes in their capability, what is the being level change, like the changes in the mindset. And second is what are the systems level change. Like suppose government is investing 1,000 crores in a targeted geography and in a targeted manner, so those are all system level outcomes, plus the partnerships with the government, the state and non-state actors. And third is what are the organizational level changes, like for the organizational like Pradhan or any other organizations, like building the confidence or building people is one of the core offering of our Pradhan organization actually. And fourth point, fourth learning has been like evidence-based learning, which is very critical. What Rukmini was sharing in the education part in the first half. So I think when the learning is the major focus, then I think monitoring, evaluation, so all those things should be there, but this learning should be the major focus, and how we can generate this real-time data collection process and how this can be more evidence-based. So these are the four learning that I would like to highlight while writing my chapters, and I think Beth, you can share.
Thank you. I have a word for the sentence for what both of you described in terms of micro studies and macro studies in human development. It's a rich tapestry of colors describing the lived reality of rural communities across India. It is an artwork where you will find diversity with a beautiful, complex blend of many vibrant livelihood approaches adopted by the government, by the NGOs, and by philanthropies alike. This is a woven fabric that we have constructed for you. So I thought this is a time for acronym in this world. So R and D. So R is for relevance. What is the relevance of this particular volume? N for neutrality or impartiality, and D for data. Already, I think you heard, Nivi talked about the data, the evidence-based thing. Otherwise, as Aarti said in a previous session, Aarti Ahuja, that policymakers, even though they may have conviction, but they need evidence to put to policymakers, to politicians. What is the evidence for a new policy? Let me talk about, start with a story about the relevance. And I'm quoting it from Ashoka Modi's book, where Amarjit is very fond of. And let me straight away also say, thanks to Amarjit, all this is possible. Single most contribution is bringing us together. And of course, ISB and the Bharti Institute of Public Policy. And so in 2019, 12.5 million young Indians, virtually all of them with college degrees, applied for 35,000 jobs as clerks, as timekeepers, and station masters in the Indian Railways. For each person who would eventually get a job, 350 would not. What happened then? You can guess. 2 years later, in January 2022, job applicants set ablaze train cars and vandalized property. I bring this to you because in livelihoods, I am talking about the dimensions of employment. This year's economic survey also talked about employment. Another dimension I think dimension or the overarching thing is about our future. हम विकासशील देश हैं, लेकिन विकसित बनना चाहते हैं. हमारा सबका एस्पिरेशन है या अभिलाषा है कि 2047 तक हम उन देशों में गिने जाएं जो विकसित हो गए हैं. तो उसका इनकम का डेटा क्या बोलता है? हम $4 ट्रिलियन इकोनॉमी है, हम $35 ट्रिलियन बनना चाहते, तो 8-fold इंक्रीज हमको चाहिए. वॉट एवर इज इट्स कॉल्ड एक्सेलरेटिंग इंडियाज डेवलपमेंट. This is the title of Karthik Muralidharan's book also. If you look at but this is not enough in the context of what we are talking about. What is the per capita income? Per capita income of Indians, according to IMF, is not my data, is $2,820. What is that of the average American? $80,000. चलो वो तो बहुत दूर की बात है, but let's go across the Himalayas. What is the per capita income of the average Chinese today is $13,300. So at least 5 times we have to become that kind. So per capita wise, we are very much short. Can we pick up? Of course, China will continue to make further push to per capita income. This is the context of employment income in which this book is located. I went to China as a Schwab awardee and part of the World Economic Forum, and I saw and I heard them say that only 7% of GDP contribution agriculture makes. We make about 14%, 15%. Only 1% of Chinese are employed in agriculture or in rural livelihoods or rural development, and we are 50 or 60%. So this book actually talks about many approaches that we are saying not necessarily farm-based livelihoods. We have to talk about non-farm, we have to talk about informal workers, we have to talk about what kind of livelihood approach can we develop so that the young rural Indian who doesn't want to work on the farm, he wants to migrate to the cities. What is it that we can do? So what can we do about the PBTGs who are very, very poor? This book especially talks about those at the margins. It also makes a point across all studies that diversification of livelihoods will lead to rural transformation. Not a single sector or a single silver bullet kind of approach will not happen. Now, it suggests, what about governance? People who are to be trained in Mussoorie Academy or otherwise, what is the adaptive or what is the governance framework for leading this rural transformation? The book is positing that we need not a traditional government model with hierarchical structures and static rules, but state capabilities need to be built for problem-driven iterative adaptation. And this is a mouthful, but essentially how could we focus on problems as many of these studies are talking about. Before I end, I would say that while this volume has covered many of the work, many things that we are talking about, what Pradhan has done, what Seva has done, what we are seeing in the tanks, in the rainwater harvesting tanks of Bundelkhand, or what we are seeing in the keystone areas in the Nilgiris. But there are many areas, many gaps that also we are highlighting. We need better infrastructure and market linkage. We need targeted support for local enterprises. We need entrepreneurs like a reverse brain drain, come back from cities and establish enterprises that will actually establish value chains to the market. We need enhanced skills and training. We need decentralized manufacturing to take care of migration. Recently, when the new Bihar government, it has 7 निश्चय. 7 निश्चय में से एक ये निश्चय है और पहला निश्चय है कि 1 करोड़ जॉब देंगे. वो बिना enterprises के, बिना decentralized manufacturing के, and they will create that kind of wage level which we see in Gurgaon, or they see it in Bangalore, or they see in Bombay. That is the kind of transformative rural transformation, or you can call it the block level transformation is required to create and reverse migration. And of course, we need sustainability and ecology of livelihoods. And let me say, NRLM has done a lot, but we also need even more access to credit. Women entrepreneurs need to get credit. So there are many areas, I think, that we are highlighting. That one thing I must say, NRLM is the common framework that has kept us going. It's the most effective policy network we have seen, especially from the point of view of women's economic empowerment. So several studies, several cases are actually talking about whether Neeta's or Charanjit Singh Ji's or Alok. Several people have actually built on the work that has happened. Charanjit Ji is here, Anil Kumar Ji is here, from 2011 particularly. Of course, the story began in 2001 with the DPIP. So that is what is very much at the back of the policy that we are actually prescribing. If you listen to Deepak Nair say, we have to prescribe some policy framework. I'll end here. Back to Nivedita.
Thank you so much. I think we'll do a quick round and then move on. We are in good time. I just wanted to say that it's been a real pleasure to work through this and to reach, if I were to choose one big takeaway for myself personally, I think it is the agreement with government people, with NGO people, with academics, all of us together. We seem to agree on many things. And the one I want to highlight is how public and private investments and bank credit from the banking system need to fund these pathways, because it cannot happen without proper focus on what I call now the strategic division of financial labor. And it's about time that we looked at it as labor rather than investment. Now, this financial labor and these institutions, the book actually, the chapters throw light on these, if you look at it from that point of view. Number one, to maximize public funds through convergence, through large-scale government programs in whatever space. The second is CSR and philanthropy as risk capital. So incubating new models, high-touch mentoring that government budgets often can't cover. Innovation. So for example, a good example, if you'd all like to read, one is the FTRVC, which was established as a joint venture between the government and Tata Trusts, and Alok is here, to provide professional management for women-led FPOs, which is a civil society structure. Mentorship, so philanthropic funding to support intensive coaching models, the Buddha fellowships, the graduation approach, to nurture local people. You also need adaptation, like the Axis Bank Foundation actually provides flexible capital to test climate resilience, to support adaptation. Credit, not at all mentioned in the book because it is so not forthcoming. We agree that banking system really needs to rise up. And last but not the least, we agree on institutional support for NGOs and the work, say, with Pradhan, the Central Silk Board, and philanthropic organizations focused on institutional building for the Tussar development work. So this is really important and needs to be focused on. That's my takeaway. How about you, Saroj?
So I think very similar, Nivedita. So many a times we think like we know everything and we work in silos. And suppose we are working in 10 panchayats and we want to scaling up of our intervention in the 100 panchayat. But we need to think what works at scale rather than scaling up. And scaling up does not mean only the numbers actually. The processes, the institutional learning. So this is the point that I could gather from the while going through this last 2 years experience. And second point is like we need to focus on the 3E framework. So one part which is in the book, it's very clear actually, like the economy part, the rural economy part. So what are the pathways for prosperity and how to boost the rural economy? Second part is the ecology part, where the landscape taking into considerations the agriculture, the regenerative agriculture practices or the natural farming. And then third is the equity part, where we talk about the women SSGs, the BOs, gender-based interventions. So I think these 3 parts are covered in this book. So we need to review all the cases and then see what we can integrate in all our programs that we are doing. And third part is the multi-stakeholder orchestration and the convergence. How we can trigger this convergence at the grassroots level by decentralized community actions and more than 100 million women were organized into SHGs. So how the SHGs, women and the panchayats can play a much larger role to trigger the, transformation at the grassroots, and how the civil society organizations plus markets, technical institutions, government can play more support role to trigger this transformation, so that the locus of initiative has to be from the community and the locus of control has to be with the community institutions. However, the locus of influence could be much larger actually. Yeah, thank you.
Thank you. I want to build on the point that was made earlier before lunch. How do you, this is a collaborative space that has happened in writing. How to create a permanent and more formal and more continuous collaborative space between the government and the NGOs and academia. And I think Vandana made this point in the previous thing. So I want to highlight it has been a pleasure being an editor. But I have not done any editing. I have not hardly contributed to editing because I learned so much by listening to and reading the chapters written by. So Knowledge Cafe example that Anjal, you not just coined, you innovated. So first I was listening to Sinhaji in about PVTG. Those 10 minutes, I learned so much more and so clearly about PVTG. I have never, I've worked in tribal areas for all my life, but that is such a pleasure to understand. While editing, I read Bala's paper about Satat Jivika. I must have been to Jivika 20 times, if not more. But in reading that paper, I understood the depth of the work, the evidence that he adduced, wonderful. Third, similarly, I enjoyed 6 NGOs' work in Bundelkhand, although Srijan is very much part of it. But it was co-written and huge emphasis in terms of, a huge contribution in terms of writing quality by Mr. R. Parshuram. So I again enjoyed reading. I've known him, but I didn't know he writes so well. So third and fourth, Snehata Nath, who is the founder, co-founder of Keystone Foundation in the Nilgiris. So again, he's a member of RCRC, the coalition we lead again. And Dhruvi, I only relate to her Paisa De Do as a donor, but here we found her to be in a different mode. So I think I'm highlighting this collaborative space is a rare one, it's a beautiful one, and we go beyond the existing rules. So congratulating not only Amarjit, but all of us in making this happen, and I think more formally it can happen, more permanent can happen. That would be great. Thank you.
Thank you to the panelists for sharing a brief overview of the volume. May I please request Mr. Amarjit Sinha to please be on the stage and felicitate the panelists. Thank you, Mr. Sinha. Thank you to the panelists. Ladies and gentlemen, before we begin the next panel on climate action and justice, we take a brief pause through music. The song, It's About Time, speaks to urgency, responsibility, and the need for timely collective action, sentiments that resonate strongly with the climate discourse today. Please join me in welcoming Mr. Siddharth Mukherjee on the piano.
So, just a little while ago, I heard Professor Nair remind us all that we have miles to go. So I'd like to add a little bit to that, a sense of urgency by saying that it's about time. There's a full moon over India, and Gandhi lives again. And who's to say you have to lose for someone else to win? In the eyes of all the people, the look is much the same. For the first is just the last one when you play a deadly game. There's a full moon over India, and Gandhi lives again. And who's to say you have to lose for someone else to win? In the eyes of all the people, the look is much the same. For the first is just the last one when you play a deadly game. It's about time we realize it. We're all in this together. It's about time they found out it's all of us or none. It's about time we recognize it. Changes in the weather. It's about time. It's about changes, and it's about time. There's a light in the Vatican window for all the world to see, and a voice cries in the wilderness, and sometimes it speaks to me. I suppose I love him most of all when he kneels to kiss the land. With his lips upon our mother's breast, he makes his strongest stand. It's about time we start to see it. The earth is our only home. It's about time we start to face it. We can't make it here all alone. It's about time we start to listen to the voices in the wind. It's about time, it's about changes, and it's about time. There's a man who is my brother. I just don't know his name, but I know his home and family, because I know we feel the same. And it hurts me when he's hungry and when his children cry. I too am a father, and that little one is mine. It's about time we begin it, to turn the world around. It's about time we start to make it, this dream we've always known. It's about time we start to live it, this family of man. It's about time, it's about changes, and it's about time. It's about peace, and it's about plenty, and it's about time. It's about you and me together, and it's about time. This is from a very less publicized John Denver song that I found by accident, and I fell in love with it. Sorry? Very, very appropriate.
Thank you, Mr. Mukherjee, for that lovely musical interlude, and it sets the right tone for our next panel based on the volume, Changing Tides, Climate Action and Justice in India. Edited by Professor Anjal Prakash and Dr. Marcella D'Souza, This volume brings together 16 chapters by 47 contributors examining India's climate response at the intersection of vulnerability, adaptation, and justice. Please join me in welcoming our esteemed panelists on the stage. Please welcome Professor Anjal Prakash. Professor Anjal Prakash is the Clinical Associate Professor, Research and Research Director at the Bharti Institute of Public Policy, Indian School of Business. He holds a PhD from Netherlands and his work focuses on water and climate change, urban resilience, and gender and social inclusion in South Asia. He has contributed to major international climate assessments and led research on glacier-dependent river basins. Please welcome Dr. Marcela D'Souza. Dr. Marcela D'Souza is Director of the Watershed Organization Trust Center for Resilience Studies, where she leads applied research on climate change adaptation and sustainable development. A physician and Takemi Fellow of the Harvard School of Public Health, she has shaped pioneering work in community health, women empowerment, sustainable livelihoods, and behavioral transformation. Dr. D'Souza founded Sampada Trust and guided WOTR as its executive director for over a decade. Please welcome the third panelist, Professor Purnamita Dasgupta. Professor Purnamita Dasgupta is the chair professor and head of the Environmental Economics Unit at the Institute of Economic Growth, New Delhi. Her work examines the links between environment and economic development. She holds a PhD from Jawaharlal Nehru University and has been a visiting professor at Cambridge and Johns Hopkins. Professor Dasgupta's work spans climate strategy, clean energy transitions, and economic evaluations of environmental change. I now hand over the session to the panel.
Thanks, Nimisha. A very warm welcome to all of you in the session on changing what we call changing tides. And that's something which is very apt because as we are seeing, climate change is more striking than before. Every year we are seeing new records being actually broken from the old one. And I was recently actually, just 2 days before, I was in a panel on a popular TV channel, and they were asking about AQI and how much climate change has to contribute to the pollution in Delhi and the region here. And I was telling them that for last 5 years, same panel I'm actually representing and same thing we're talking. So I will not speak much as that, it's more action that is needed. We already have so much of information. That knowledge is there, but it doesn't lead to wisdom. And that's exactly this book is also poised. We are trying to see how climate change an action that we're looking at from the perspective of, especially from the grassroots perspective, how is it rooted in equity and justice framework? And this book is actually about that. We have about 46 authors who have written this book, edited volume with two of us as editors, Marcela and I. There are 389 pages of research work has gone. And one thing which is very interesting about this book is that it actually talks about grassroots level innovations. There are 6 topics that we have been looking at. One is about equity and justice. Second is about climate change and policies in India. Third, we are looking at the innovation which is happening at the grassroots level. There are 4 or 5 innovative projects which has come, which this project is documenting. We're also looking at inclusiveness and also international cooperation. So this is something which we have seen from the Indian perspective, where we see that the literature is much less. So when we were actually planning, one premise of this book was that we thought it has to be edited with the academic person in mind, but at the same time, we also have to have a practitioner on board as co-editor. And Marcela's name came to me instantly when we were discussing about this, because I know Watershed Organization Trust's work for the last 3 decades have been working on ground and trying to see how things changes on ground. And definitely, we also have Purnamita, who's a stalwart, I would say, in climate action, especially, has been part of IPCC for almost 2 decades. Now she's the coordinating lead author in Working Group 3, looking at climate finance. And all that is the hands-on people who are working both from bottom up to a top-down perspective. So I'm going to have some very interesting conversation only with three of us together. So first question, let me just ask you, Marcela, in terms of looking at the sub-national framework of climate change in India, and how is it, it includes climate action. What is the perspective on this? Over to you.
Thank you. Thank you for this challenging question, because coming from the grassroots is the question of how do we look at the sub-national action plans that are required. And coming from the book, because there's a chapter written on it, and a very well captured piece, which tells us that on the one hand, we have the National Action Plan to address the climate change. At the same time, we have the NDCs that we have to adhere to. And the question is, how do we get this from the national level down to the ground where it happens? And when we look at the Indian context, the subcontinent, we have 127 or more agro-ecological and climatic zones. So how does this all capture at that level? And that's where the relevance of the state action plans and the subnational plans are important. Because each state is looking at its own agro-ecological and climatic zones, the diversity that is there, the challenges that are being addressed there. And that's where the richness of it comes along. However, the article brings out very well the challenges that are faced in developing this sub-national action plans. Is there a similarity between all the states? What is the thoroughness with which it needs to be looked at? How do we get the different departments to work together in synchrony? Because it's a common agenda where every department has something to contribute to. And moreover, what is this financial a component that has to be addressed in order to meet the challenges? And this article brings out very well these challenges that need to be addressed, and attempts that are being made, because there is a framework to be done and how it needs to be done. More recently, we have seen that in the state of Maharashtra, they've come out with a very good state action plan that was looked at, and where it is also looking at capturing ground data, groundwork that is going on. And just to add, coming from the various papers that have come into our book, as well as from the others, I think as we go along for the sub-national action plans, the information and the researched work coming down from the practitioners is going to be a big role in having a diversity of approaches, but aiming at the same outcomes. So that outcomes is important, and this is where the contribution can be.
Thank you so much. Let me just cross over to Purnamita. Purnamita, you being an economist, and we know there's so much of ho-hangama going on in terms of the growth of economy in India being whatever stage of economic growth that we are in, and we're going to soon cross over other countries. But at the same time, we also see that the climate action, there is a, especially at the grassroots level, there's this kind of a gap between, in terms of understanding and also in terms of intervention. So how do you see this? Is this a conundrum that we are looking at economic growth at a larger level, but we're also seeing lack of climate action, or you see otherwise? What's your view on this?
Thanks. First of all, it's an opportunity to say thank you to my two editors of this volume. I think they did a great job. And it's not an easy topic, as Anjal's questions are indicating. They didn't make it any easier in terms of topics, but they did a great job of facilitation. I remember we had debates, and fairly aggressive ones, at ISB when this book was being developed and conceptualized. Anyway, having said that, so I think it's a slightly moot question to think of whether India needs economic growth at the macro scale, or whether this growth is trickling down sufficiently as action on the ground and things. I think there's too much out there on these, but your question is pertinent from the point of view that my way of looking at it is that we had sort of got used to thinking of the natural and the social systems separately from the economic systems. And I think we failed to do the job as social scientists, some of us, which natural scientists actually have always recognized that there are feedback loops in nature. But we forgot, as economists, as maybe ordinary citizens for a better life, that the natural and the social systems have to be aligned with the economic system, with whatever forms of capital accumulation that we want. And I think that is where we have now been hit with the long-run consequences of ignoring nature for a long time. And and that itself has become a road towards inequalities, that has become a road towards deepening of ground level, I would say, injustices, and of course all the host of environmental consequences. And in that sense, I would say you raised the issue of air pollution. I've been approached for similar programs and I've actually said no to them because I've had enough of going on media and saying the same things year after year. But then, you know, if you think of ticking boxes, so Delhi is a city where you have one of the highest per capita incomes. Delhi is the city where the top politicians, legislators, and some of the media people also stay. Delhi is a city where so much has been written about. So which box do we not tick in terms of economic capacity, institutional capacity, knowledge, all of it? In terms of all these boxes, we tick all of them. So air pollution is a great example to teach of which is the box which we are missing on. Why can't we still act? Why are we still so willing to keep on breathing the polluted air? And I don't think that economic growth can create the surplus to be able to tackle it. But the question is not now of not having the surplus. The question is how you use it. And the same argument flows down to climate action on the ground. It's how and the quality of growth. We haven't paid attention to it.
Yeah, thanks so much, because that's exactly the question I actually wanted to ask Marcella, because you have almost 3 decades of working with grassroots women and men, especially in some of the most kind of purged districts of India. What has been your experience, Marcella, in terms of looking at the climate action at the local level? What is that we lack there as against all talks that we do about climate change at the very, very high level?
I'm going to come back. I'm going to come back again from what I've learned during while editing these papers, and I have to say it has been a tremendous learning and beautiful learning experience. I think what we lack, and most of the time, is that we assume a lot of things and we jump to those conclusions that we have in our head. Whereas what the papers have shown us, I'll take 2 case studies that we looked at. One that was looking at the stubble burning on the one hand. The other one that looked at how is dryland agriculture and farmers living there being addressed. It's a little related also, the second paper, to the previous book on the rural livelihoods. And what we find, it was during as a part of these studies, we begin to understand, on the one hand, what is driving the farmers and the villagers, the rural community, to do what they are doing. And having a better understanding of the drivers of that. And for instance, on the one hand, we see, and we are seeing it extensively, the push towards agriculture is increasing, that even in dryland areas, more and more farmers are shifting from grassland agriculture, which was livestock, and in Maharashtra parts of it were selling kava, to moving into agriculture. And the driver is they assume that agriculture brings in the income without realizing what is the economic, the so-called economic gain that they are aiming for, and the cost of the degradation that is taking place. That has been a really powerful learning that I had in this process. And in the same way, understanding what is happening with the different, why are they burning the stubble? Who is burning it? Why are they burning it? And mainly we found at the bottom of it is the income. If farmers have more members of households in agriculture, there is less stubble burning. If they do certain methodologies, and what we found, this is a study from Andhra Pradesh, not from Punjab. So if they have mechanization at the time of sowing, then there is less stubble burning because of the way they have done it. So if we understand better the drivers, the causes, and what happens, then the investments need to go at the right, for the right appropriate mechanisms, and at the same time promote those kind of cultivations for the farmers. Promoting diversified, good agriculture practices will address the issues of extensive monocultivation in drylands. So it means going back, learning from the farmers, doing micro studies, and learning from these all these. Yeah.
Okay. We are doing well on time, so I'll just go to the last round here. This is my favorite part of the question, and that is targeted to Purnimita, because Purnimita has been part of IPCC for far too long. One cycle, she was also a negotiator from Indian side. So she has seen both sides of the ring. And my question to you, Purnimita, is in terms of climate action, in terms of the justice framework that we have been professing, how are we faring in terms of our negotiation at the international level? What is your opinion about it?
I said he never makes it easy for me. Of course, with someone like Mr. Rashmi in the audience, I feel rather overwhelmed with the question. He could do a much better job, perhaps, of answering that. I think, actually, if you ask me, I think we're doing rather well. Because we've learned through hard experience that a lot of the time that is spent in talking about, in talking at the negotiations does not necessarily materialize in a solution that works on its own. There's always a context to it. There's always an issue of coming away dissatisfied by the global south in general. And I think it's anchored in the fact that you have, where 30% of the world telling 70% of the world what should be done. How do you get away from this basic inequity at the international stage? 70% of the world being told how they should live, what they should do, how they should grow their crops, what they should do. Now, this is a slightly different thing from the 70% themselves wanting to change, wanting to improve their quality of life, wanting to change the way we live, wanting to build resilience. And here we're talking about climate, then climate resilience, economic resilience, social resilience. These are things that we want to do for ourselves. If you look at, so I think this is a great driver. The motivation comes from within us. But if you have an international fora which is telling you to adopt a certain, what I call a sufficientarianism principle. There was a great example that Mr. Arya gave in terms of the differences in per capita incomes. But if you get into other indicators as well. You see the same sort of thing happening. What are you saying? You're saying that target your energy consumption at this level. Target your health indicators at a certain level. Yes, we know that. We want to target it, but we want it to be a step at a time and a staircase to climb. Right? That's the aspiration we all have. And sometimes, depending on how vulnerable you are and who you are, that is not even the starting of an aspiration. That's an essential kind of frontier. So I think that's the perspective with which we stand up and make ourselves count at the international fora. And that's where I think we're doing a pretty good job these days.
Yeah, thank you so much. That's very good to know. Let me just go on to last round. We have 6 minutes left, but Marcella, let me ask you this question in terms of, is there any gap that you see at the grassroots level? Because we've seen climate action, all these, talk show that goes on at the very, very high level. We've been part of IPCC and all the assessment is happening. My question and my problem also is that doesn't percolate much on the ground. It's a very talk show kind of stuff. Do you agree with this? And if you, yes, then what is that we should do to bring it down to the last person?
See, at the top level, all of us are talking of it as if it is out there. Whereas for the rural communities, they are at the brunt end of it. They are facing it, and more than that, they are facing daily survival. So the question is, quite often I've heard, people in the rural areas should make the changes that are required. Why are they not doing it? Why are they not taking care of this and that and water, etc.? Without realizing that their whole survival, their income depends on that. So when they are there facing the challenges, and challenges at all sides, they're facing a lot of externalities. So that is where they are looking at from one moment to the next. So the point what I consider is, how do we change our way of approaching it? How do we look at it from their perspective, address the needs that need to be done there? And there have been attempts that are being made, and it has come out in all the stories that we have. I'm calling them stories because they're real beautiful stories, and real life stories, which have told us what makes the change. And how do we address it from the people's perspective, from the needs perspective, beginning with how do we understand what is the challenge they face.
Yeah, thank you so much. Let me just do 2 questions and then we close this. So Purnamita, my question to you is, we have seen the literature on climate action justice over the years, and there has been very few of them looking at it from that perspective, and that's why this book has also come about. But if we have to do another book together, possibly 3 of us editors, what would that be? What is that you think is a gap in research at this moment?
I think one of the things that we have to very consciously talk about is that there are different types of justice out there. So far and for good reason, like at the international scale, or at the regional scale also perhaps, we talk about distributive justice. But there is recognitional justice. There is restorative justice. There is procedural justice. The more effort we put into mainstreaming these, into the design of our plans, whether these are adaptation plans, mitigation plans, all climate action plans. I'm restricting myself to climate here because the session is basically focused around climate, or any environmental policy, or a policy that has implications across a developmental sector and environment, say health and environment, for instance. I think we have to put much more effort into understanding how can we push ahead those different types of justice. Because once we do that, then across sectors, across communities, then you're going towards trying to bridging those gaps better.
Marcella, same, yes.
Yeah, this point I want to raise over here is, we are looking quite often these days at a justice which looks at individuals, reaching out to individuals. The biggest challenge is when it comes to land, water, these natural resources, these are common properties. These are common resources. So we need to look more and more from a communitarian perspective and helping because a problem is always localized. So no one from whatever reason, all of us as practitioners, even we are out of a particular region, we are a third party to those. It is the training of the local communities to look at it from a communitarian perspective and putting it within them to address the diversity and the justice at that level.
Thank you, Marcella. That's Climate Change and Climate Action Justice book is for you. This is Changing Ties. This book is actually, as I said, 368 pages long, but it's freely downloadable. And you can actually download it from our website, also Ripley's website. It has very beautiful case studies, 16 of them all together, so it will be make you a very happy reading. Thank you so much for listening to us. Thank you.
Thank you to the entire panelists for this insightful discussion. May I please invite Mr. Amarjeet Sinha to please felicitate the panelists. Can we have a huge round of applause, please? Thank you, Mr. Sinha. Thank you to all the panelists. As we move to our next panel on institutions and social development, we reflect on leadership, courage, and moral clarity. The song Ekla Cholo Re reminds us that meaningful institutional change often begins with conviction, even when the path is solitary. I'm pleased to invite Mr. Siddharth Mukherjee for this final musical interlude.
So, not much need be said of the song Ekla Chalo Re. So I begin right away. যদি তোর ডাক শুনে কেউ না আসে তবে একলা চলো রে যদি তোর ডাক শুনে কেউ না আসে তবে একলা চলো রে একলা চলো একলা চলো একলা চলো একলা চলো রে তবে একলা চলো একলা চলো একলা চলো একলা চলো রে যদি তোর ডাক শুনে কেউ না আসে তবে একলা চলো রে যদি কেউ কথা না কয় ওরে ওরে ও ভাগা কেউ কথা না কয় যদি কেউ কথা না কয় ওরে ওরে ও ভাগা কেউ কথা না কয় যদি সবাই থাকে মুখ ফিরায়ে সবাই করে ভয় যদি সবাই থাকে মুখ ফিরায়ে সবাই করে ভয় তবে পরাণ খুলে তুই মুখ ফুটে তোর মনের কথা একলা বলো রে তবে পরাণ খুলে তুই মুখ ফুটে তোর মনের কথা একলা বলো রে যদি তোর ডাক শুনে কেউ না আসে, তবে একলা চলো রে যদি তোর ডাক শুনে কেউ না আসে, তবে একলা চলো রে। যদি আলো না ধরে ওরে ওরে ও ভাগা আলো না ধরে, যদি আলো না ধরে ওরে ওরে ও ভাগা আলো না ধরে, যদি ঝড় বাদলে আধার রাতে দুয়ার দেয় ঘরে, যদি ঝড় বাদলে আধার রাতে দুয়ার দেয় ঘরে, তবে বজরা নালে আপন বুকের চাদর জ্বালিয়ে নিয়ে একলা দলরে, তবে বজরা নলে আপন বুকের পাঁজর জ্বালিয়ে নিয়ে একলা দলরে, যদি তোর ডাক শুনে কেউ না আসে, তবে একলা চলো রে, একলা চলো একলা চলো একলা চলো একলা চলো রে, তবে একলা চলো একলা চলো একলা চলো একলা চলো রে, যদি তোর ডাক শুনে কেউ না আসে, তবে একলা চলো রে।
Thank you, Mr. Mukherjee, for that lovely, lovely performance. Ladies and gentlemen, we now come to the sixth panel of the day, based on the volume, Reimagining Institutions, Collaborative Pathways to Social Development in India. Edited by Dr. Pushpinder Singh Puniha and Dr. Arushi Jain, this volume brings together 17 chapters by 25 contributors examining the institutional challenges that shape social development outcomes in India. The book explores governance gaps, last-mile delivery challenges, digital governance, labor dynamics, and gender-based violence, while also identifying pathways for institutional reform and collaboration. With that, please join me in welcoming the panelists on the stage. Please welcome Dr. Pushpinder Singh Punia. Dr. Pushpinder Punia is the chairperson of the Consultative Group on Tax Policy at Niti Aayog and an advisory board member at Blue Ocean Corporation. A leading expert in public finance and governance reform, he holds a PhD in collaborative governance in finance from the University of Southern California. Renowned for pioneering India's faceless tax assessment reform, Dr. Puniha brings strategic insight and policy leadership to advance transparent, future-ready governance frameworks. Please welcome Dr. Arushi Jain. Dr. Arushi Jain is the Policy Director at the Bharti Institute of Public Policy, Indian School of Business, and an Edward S. Mason Fellow and John F. Kennedy Scholar from the Harvard Kennedy School. She holds a PhD in Public Administration and advanced degrees from Oxford University and MIT JPAL. A respected public policy professional, she has taught extensively at national training academics and contributed to governance reforms and social impact initiatives in women's empowerment, education, and rural development. Please join me in welcoming the third panelist, Mr. Sampath Kumar. Mr. Sampath Kumar, IAS, serves as Principal Secretary and Development Commissioner to the Government of Meghalaya, overseeing key departments including health, women and child development, and rural development. An Edward S. Mason Fellow from the Harvard Kennedy School, he has led major governance reforms, strengthened village institutions, advanced the women's SHG movement, and established the State Capability Enhancement Project and Government Innovation Lab to promote innovative, community-driven development. With that, I now hand over the session to the panel.
Thank you so much, Nimisha. A very good afternoon, everyone. This panel is on reimagining institutions. And, when we think about institutions, institutions are not designed in particular. They are something, that citizens experience in themselves, by themselves. And while, the two of us were looking at the chapters coming into the book, there were really interesting insights that we got. Some of them were about, how contributors are looking at institutions and from what level are they looking at these institutions. So, for example, there were many who were looking at the grassroots level institutions, whether these are the Panchayati Raj institutions, whether these are the women collectives, or many similar institutions. There were some who were looking at the state as the anchor and looking at institutions within the government, whether that was at the district level, whether that was at the state level, looking at state capability, and so on. There were many who actually looked at institutions that are invisible. Institutions that are invisible, but they become visible only when there are issues, when there are crises. And there are a lot of chapters that have been dedicated to these institutions. Communities in particular have formed a lot of ground in all the chapters that we have in this book. And whether these are chapters in Panchayati Raj or rural development, whether the chapters talking about demography, right from an aging population to looking at a demographic dividend in the country, there is a huge variety that we have, in this particular volume. And I have with me two exceptional people on my right and the left, with whom I'll be talking about institutions, but more importantly, how these institutions can be re-looked at, how we can reimagine these institutions, and what will be the most important factors of reimagining institutions. So, before we delve into this discussion on institutions and reimagining them, let me step a little back, and my first question will be to Dr. Punya, because, his research and his PhD has been on collaborative governance. And, you can see, if you read through the first chapter, there is a depth of knowledge around the theoretical frameworks that have been used in building the context on institutions. So my first question to Dr. Punya would be to talk about the conceptual framework and how can we think about institutions from this lens and what makes a successful institution.
Thanks, Dr. Arushi. And before I really come down to the academic rigor which we have in our volume, let me just say that, dealing with the institutions, we answer in if not fully, at least substantially, two issues which were raised by our distinguished panelists in the forenoon session. Professor Deepak Nair raised an issue that, look, these volumes are dealing with micro studies. I am a macroeconomist. How do we, transform these micro studies into macroeconomic outcomes and policy matters? So my partial answer to that is that, sir, our volume, which deals with institutions, and institutions lie at the heart of a society's capacity to ensure development that is inclusive, that is participatory, that is enduring. They shape the design and delivery of public services, and they influence the citizens' engagement and determine how rights and responsibilities are experienced by individuals and communities. So we, in some way in this volume, are meeting part of the issue which he had raised, that how these micro studies can be taken in at the macro level by looking at the institutions and how collaborative governance can help these institutions to perform these outcomes and result in better outcomes for you. The second interesting issue which was raised in the morning distinguished panel was by Mr. Shekhar Bonu. He raised an issue which is very close to my heart because I've been a professional most of my life and then, partly an academic, that, academicians basically look at, particularly the economists, that I want quantitative answers for outcomes. Then only, something matters. And, whereas the case studies are, both qualitative and quantitative analysis. So my answer again there is that, Mr. Shekhar Bonu, your question is very valid. But in this volume, we have given the academic rigor of theoretical background of institutions, starting from history to the current, so that, even if we do not have the complete quantitative data, we have the support of, case studies and all from across the world, and where all the academic experts dealing in this topic support this, that yes, if you have participative, stakeholders, they produce outcomes which are better, which are more equity oriented. Now, let me be also very clear that the ambition of our volume is neither to celebrate nor to dismiss the existing institution framework, but it reflects, as Dr. Arushi rightly pointed out, critically on how institutions function in the context of social development and how they might be reimagined through greater collaboration, contextual understanding, and public trust. So, that is what our volume talks about, that, once you produce participation, stakeholders' involvement, then the outcomes which are likely to come are better than what we can normally take. And the strength of our volume also lies in its refusal to reduce institutions to static framework. We say these are neither static frameworks or technical system. Instead, our case studies embrace the idea that institutions are dynamic, they are evolving, and they are situated in specific cultural and political contexts in which they operate. And the authors have offered grounded insights on how institutional arrangements have either succeeded or failed to address the multiple dimensions of social development in India. And just to give you an instance from that, how things evolve. Let me give you an example from Dr. M.S. Swaminathan, the so-called, the father of the Green Revolution in India. He is the guy who, from Dr. Norman Borlaug, got the high-yielding varieties and, made it demonstrated in the forms that, to the farmers that look higher production and productivity can be achieved by these high-yielding varieties, and led to such substantive growth in agriculture productivity and production that India, from having starvation death in 1960s, became self-sufficient in 1970s. But subsequently, same Dr. M.S. Swaminathan, in the 90s, when he realized that, this green revolution technology is causing, water problem at some times, is causing more inequality in the rural areas, he came up with a policy called the evergreen revolution, which was not, that instant high-yielding varieties need to be brought about. So this is what our case studies, micro case studies, which are there in our volume, dealing with demography, dealing with, self-help groups, dealing with agriculture, rural development, dealing with administrative system, talk about that, we have to be contextual, we have to be specific to the situation, and we have to be humble enough to, realize that, okay, I have achieved the short-term outcomes, but for going for the longer outcome, you have to take a different viewpoint. So that is what one major contribution I think of our volume makes, is that institutions have to be taken as something which evolve over time, and they cannot be taken as static or systemic. And for this, the kind of theoretical background which we have used is we have started from, looking at how Adam Smith talked about, that humans act rationally and we respond only to, the economic and financial incentives when they are given to us. But Adam Smith's contribution was wonderful. He said if you can put up a regulatory framework which is good enough, then self-interest leads to desired social outcomes. Maximum, at least, outcome. If not desired social outcome, the maximum outcome is achieved, even if you act in self-interest. And the concept of self-interest was subsequently improved, and I really am someone whom I really admire is Alexis Tocqueville's work in Democracy in US in 1835 or so, when he defined how US has achieved huge development in 19th century by, reducing self-interest into self-interest rightly understood, which was that, I act not purely in my self-interest and overlook everything, but I limit my self-interest by some discipline, by self-denial. I'm concerned about the community and all, and that is how the desired outcomes are taken, produce results. And if you bring that into our Indian cultural situation, then you find, that how our own cultural purusharthas, what are called, that we by Indian culture do not respond only to, what we call the karma. We are concerned about righteousness also, we are concerned about earth, we are concerned about prosperity, but we are concerned about, my community image also. And examples of this exist, so many of them, like what I have experienced in the field also, from the tax matters. When I went to the startups, Niti Aayog sent me, and then, I thought they are going to ask me, give us cheap finance, sir, give us tax concessions. And I was sent to MSMEs also, the small industries. I thought I will get the same kind of, demand from them. You know what they came up with? The MSME guys told me, sir, look, we are owners of this small business, but this business runs because we have 4 or 5 close friends who are our employees though. But our business cannot run without them. We had the money, so we have started owning this business. When the lowdown comes, we are not in a position to pay salary to them, then they may leave our business. That is when we fail. So when cyclical lowdown comes, sir, permit us that these employees who are our close friends also, we can make them minor shareholders in our business, make the transfer of shareholding, minor shareholding to these so-called employees, tax-free, then they will continue in the business and they will also provide some scales taking for more money also. So that is what they said. Same the startup guys told me. They said, we have valuation is very high, we do not have any cash with us. As and when we are in low cycle, permit us to give our shares to those guys whom we want to keep employed so that we can scale up. So look at this. Once you go to the ground, react with the field guys, they come up with solutions which are effective and which produce wonderful outcome. That is what the case studies in our volume on the institutional structures have shown in different sectors across the economy and across the society. Thank you.
Thank you so much, Dr. Punya. Let me go to Mr. Sampath Kumar. And Mr. Kumar, your, institutions do not work in a similar way, and there's so many factors that lead to the same. So your chapter uses the idea of state capability rather than simple administration or implementation. How do you use state capability in that context? And how do you think, the state capability can be enhanced? And if you can reflect on your own work in Meghalaya and what your chapter brings in.
Thank you. Thank you, sir. First, I'd like to say my profound thanks to Amarjit Sinha, sir, for actually bringing me into this forum, and also the ISB and all the distinguished, authors and speakers with whom actually I could able to interact in previous sessions. So it was really helped me to deeply reflect and, come out with this particular chapter, what we have been doing. We're trying to experiment differently. I just want to tell you how this entire idea, maybe there is some context I would like to give, how actually this building state capability work that what we have been experimenting in Meghalaya. So we in fact, there is you always, I think you all aware, states are seen as an implementing organizations, more of a implementers, and there is a policy, there is a programs, and how the states are implementing. So, and in the process, the states also, most of, wherever I have seen, I worked in 3-4 states. So wherever I've seen is that states have, taken a role that yes, I think checking the box, okay, we are doing this, we are doing this, we are doing this, but are we achieving the purpose of the programs that what we are supposed to implement? I think we are missing that purpose. And more you see the other periphery. I think in the language of the famous Land Pritchard, it's like we see donuts, but we don't see the purpose. Always institutions are missing that center, center that is a purpose. So what we have done was, in fact, when we worked on rural development work with implementation of employment guarantee program. We found this is such an amazing program, and how actually we can really leverage that program to bring a change in the state. So what we did was we have leveraged the existing traditional institutions what we have in the state, which were never used for the developmental purpose before. I think we used them. We created a concept of village employment councils, and then what we did was we built their capacity. Every year. We have a very interesting journey every year. We, as a team, we used to go about 2 to 2.5 months in the field, and talking to all the village headmen, and basically explaining different things what they can do very purposefully, not not the checking the box. How actually you can do differently. So that actually gave us tremendous results. I'll give one example. If you go by the schedule of rates of government, schedule of rates, where for every project there is schedule of rates. And they used to, build for as per schedule of rates, they're supposed to build 1 check dam, but we were observing with this approach, they were building 2 check dams with the same money, because they felt it is more useful for them. It is not just they're implementing the program; it is actually they're solving a problem of water scarcity in their village. So the idea behind this entire work was how you actually really build the capacity of different institutions. So when we did this exercise, what happened was there was a 2019, there was a finance commission visited our state, and then they said your rural development work is going well. Why all human development departments like health, education were lagging behind? So then we started deeply reflecting on it, what actually worked well, how can actually we can bring some of those lessons here. So as part of the process, we built, in fact, not only what actually we have experimented, but also we have taken some of the principles from Harvard Kennedy School, where a lot of my friends are here now. So like a problem-driven iterative adaptation approach, adaptive leadership, some of these frameworks we have taken, and we have written a strategy paper. It's called State Capability Enhancement Project, and then it was published also, and we started very consciously using it. So it has 5 pillars I just want to briefly touch upon. The first one is that, what we understood is that the state is not, not just a lot of time we spend a lot of time on the supply side, the architecture, basically the human resources and all. So state is also a lot of time we need to give the citizens, So one thing we found, the first pillar is that how you actually building that, that citizen-state relationship, what kind of institutions that we have. For example, self-help groups are amazing institutions everyone is implementing today because it builds that, it actually provides that pipeline between state and the citizens. So that's one pillar. So that actually, like village employment councils, the way we built. So one thing, like you really wanted to build a state capacity, first principle is you invest in building citizen-state relationship. Second was, we spend all the states, I think, I don't think, in fact, Maharashtra, I heard that, like, every state is spending more than 50% of their state budgets on salaries and pensions. So so then what we do, we don't expect that, like, that's a resource. And we actually engage, some, like, we feel that, like, it's not working, we try to get some external consultants. I'm not saying that I'm not against external consultants. We should use technical partnerships, but we also need to build the state capacity. So a lot of, second thing is building local leadership, how actually you are building the entire, this passive, so-called passive workforce into an active workforce. So that also we are using, again, how that can happen, not by trainings, not by actually, rigorous monitoring. It is because by giving a purpose, being, making them actually giving that, sense of leadership that, like, you are solving a problem, like you are solving, saving the life of a mother, how actually you can. So I think that actually helped us to, we are using that, for that we are using this frameworks of problem-driven iterative adaptation approach where we assemble a team, give them the autonomy, basically they're aligned with the purpose, and then, then we see a lot of local innovations, and then we bring it into the policy. So a lot of work that we have done, in fact, it resulted into contribution of almost like 50% reduction in the maternal mortality rates in the last 5 years. So that's one area. Second pillar is that building local leadership. Third one, effective use of data and research. And last workshop I met one of the colleagues. In fact, she came out with a very interesting idea of reducing stunting, and we started using it now. Statewide intervention, like how do you I think this IIT Bombay Professor Dr. Rupal. So what I'm saying, effective use of data and research, like it's there, but we are not. So the states can actually scale up. And the fourth one, of course, we are saying that address the systemic challenges. Unless you, like a gender is a very important component. If you don't actually address that systematically, how you actually participation. So some of those important ideas. And then the fifth one, I think, will be more interesting. I want to tell you, this fifth pillar is that you need to build political supportability. Political supportability, very consciously we have to build political supportability. Then actually you can sustain those interventions what we wanted to see. So that's something that, the political supportability can be been with quick wins. You need to show that, like, the work that is, in fact, Professor Deepak Nair was saying that, like, political leadership is not really looking at the human development, but if you show the results, and if that actually they can see, the connect with them and the results, I think there's more investments would come up. I think this is the briefly that actually the work that actually we have been doing. Sorry, there is not much time. Thank you.
Thank you so much. I think you've delved upon such important aspects. I think I would take away the collaboration part, which has been amazingly well done in the state. Because collaboration is the key institutional function. And the second is the trust, which is very important. And until and unless that trust can be developed, I think the institutions are not going to function well. Having said that, I know that we do not have much time, but just as very brief, closing points, there is a very important aspect in the book where we are thinking about learnings that can go from the book, whether these are chapters, we have our authors sitting here, whether these are chapters on rural development or, a private sector initiative with farmer collectives, or it could be the domestic violence and interventions that have happened in different states around that. Or it could be the institution like a deputy commissioner where the discussion is around the authority responsibility gap that is existing in today's time, and how do you bridge these kind of aspects. So lots of chapters had lots of insights, and there there are generally these discussions whether some of these learnings can be replicated or can they be scaled up in different ways. And I would like to ask Dr. Punya to kindly reflect, because you have very briefly, if you can tell us about Kudumshri or wherever you want to take an example on do you think whether something can be replicated or scaled in institutions?
Yeah, no, that's a very core question. As we talk of institutions, institutions cannot be copied and applied. As our research here points out, it has to be contextual. It has to take into consideration the local, reality of it. Like in Kerala, the decentralization and the funding to the Panchayati institutions in Kudumshri is, 45% of the development expenditure has to go to the panchayats and to the Kudumshri mission schemes, which may not happen in the other states and all. So we have to take those realities into consideration. But there are huge learning points, as you rightly pointed out, that how do you build trust in the self-help group of the ladies? So they form neighborhood groups and they make them meet every week, and out of, if the neighborhood group is 20, then they have elected persons from them also. One lady dealing with finance, one lady dealing with public health, one lady dealing with, micro enterprises and all. So they first develop the leadership and then they have tied it up slowly with the local institutions rather than a fight. What happened in Andhra and Karnataka in 2006 and 8, when the deepest, spread of microfinance was in these two districts. But since profitable people came into microfinance, there was huge protests and the microfinance failed out there. Kudumshri succeeded because they had by that time, weaved in your area development society guys who, if you put up 5 microfinance projects, that I can start my enterprise, one will be selected. They will say 4 cannot succeed. And they will take only those projects where, the major problem for the small enterprise is marketing. They would only, kind of give them where state can help them in marketing. Say, for instance, like in Kannur district in 2017, when they banned the plastic bans, they trained the neighborhood group 6 months in advance and started providing them, the non-plastic material to produce the bags and all, so that when the public policy is introduced, they can, get ready marketing. And it influenced the life of 5,000, women in that area. And it became one of the cleanest districts in India in terms of, plastic thing. So there are huge learning points based on trust, based on, how you take into account the local context, the local capabilities and the constraints, and then try and adopt the same policies at the other place. And as you rightly pointed out, Sampath, self-help groups are now one of the most talked about, and I think rightly talked about, public policy interventions which can have huge positive impact in terms of the multipliers. Thank you so much.
Any last words from your side?
Thank you. I think I'm just seeing self-help groups. Our additional secretary in charge of self-help groups and RLM is here, Mr. T.K. Anil Kumar, and former, Mr. Charanjit Singh is also there. So I just I wanted to say one word about this entire reimagining institutions, especially from the state side. State means nation state kind of a concept that I'm talking about. So one, we need a lot of institutions are there at the supply side. There's a lot of institutions at the demand side. I think maybe we need to really have a lot of clarity on actually investing on both sides. So I think if you invest on both sides, I think then you get a maximum results. In fact, what we are trying to say is that if you wanted to reach, in fact, in Amarjit Sinha's language, last mile population, you require both sides intervention. Then you can actually reach the last quartile population. I think that we are missing. We do a lot of just one example to end with is that we have technical solutions can take us only to to some extent, but we require some lot of adaptive, innovative solutions to reach the last mile population. Thank you.
Just 5 seconds, one thing I wanted, which I forgot. At times in empowerment, in self-help groups, we need to give dignity also. One example which came to me, in fact, I kind of got practically abused by that neighborhood group. This was like, same thing, like where they were doing the waste management thing and making sure that the plastic waste does not happen. And they, the slogan first they were used is beautiful. Nala Nadu, Nala Manu. A good village is with good soil. That is the first slogan which they had. And then they told me, you are calling us waste manager? We are Haritha Karma Sena. We are ecology soldiers. So that is also, these are learning points where you got to, give dignity to their work, and that empowers them. Empowers them enough to practically abuse me that you outsider calling us bloody waste manager. We are ecology soldiers. So that is also what the point which you are making. Yes. That is wonderful that, we uplift them through the empowerment and dignity to be provided to them also. Yeah.
Right. So thank you so much. And I think as editors, our interest will be in more engagement around the topic of reimagining institutions. And as we go ahead, we will look forward to collaborating with each one of you for different sessions that we will host through the next year on this volume. Thank you. Thank you.
Thank you to the panelists for this enriching conversation. May I please request Mr. Amarjeet Sinha to kindly felicitate the panelists. Thank you, Mr. Sinha. Thank you to all the panelists. Ladies and gentlemen, we now move on to the distinguished panel which brings together eminent thinkers to reflect across the themes of rural livelihoods, climate justice, and institutional reform. Please join me in welcoming the panelists. Please welcome Mr. Jugal K. Mohapatra. Mr. Jugal K. Mohapatra, retired IAS officer and former Secretary, Ministry of Rural Development, Government of India, is a widely respected administrator known for his contributions to governance, rural development, and public finance. A postgraduate in economics from the Delhi School of Economics and Boston University, he has held pivotal roles in Odisha and Union government, including Chief Secretary. Post-retirement as chairman of NABFINS Limited, he advanced grassroots financial inclusion across India. Please welcome Professor Balveer Arora. Professor Balveer Arora is the founder chairman of the Center for Multi-Level Federalism at the Institute of Social Sciences. He is a leading political scientist whose work has shaped the study of India's federal democracy for decades. Former professor and pro-vice chancellor at JNU, he chairs the CSDS Board of Governors. Professor Arora has held visiting positions worldwide and has been bestowed with the Legion of Honor by the government of France. Ladies and gentlemen, unfortunately, Mr. Montek Singh Ahluwalia could not be with us here today due to last-minute health concern. I humbly request Mr. Amarjeet Sinha to join the distinguished panel and kindly moderate the discussion. I now hand over the session to the panel.
Good afternoon, friends. Mr. Ahluwalia has been having some back problem that got a little aggravated, because of which he was feeling the pain, so he's not able to join us today. He sends us his best wishes. Sir, we have two very eminent people who've studied the subject of institutions and multi-level federalism very closely. So I would first request Dr. Jugal Mahapatra, since he has also looked at the institutional challenges volume, the reimagining institutions, what are some of the key points that emerge in your assessment of the volume, and what is the way forward on institutions that comes out on a reading of the book?
Sorry, I slightly unprepared to be the opening batsman. I thought I'll come later and sort of round off whatever has not been said. But let me sort of look at not just the one volume of reimagining institutions, but all the three volumes, because all the three volumes have been discussed. Can't say that I have read all the chapters, but honestly I have read the introductory parts, and some of the chapters which I found very interesting. I have sampled just to get a flavor of what kind of approach you have taken to explore the subject, what kind of rigor you have used, and what kind of key messages you have delivered. And it is in that spirit, I think I would say that all the three volumes perhaps tick reasonably all the boxes as per my assessment. Let me also give you a flavor of historical context to all the three volumes, all the three themes that you are discussing. And coincidentally, it happened just about the time when we began our career in civil service. I'm talking about the late 70s, mid-80s period, mid-1980s and late 1970s period. Some of the developments that took place during that time, both in terms of programmatic developments, some policy space action, and some institutional development are very relevant to what we are discussing today. If you remember, around that time, I think mid-1970s, it was realized that the so-called trickle-down approach wasn't delivering results fast enough. Not that it was not having impact, but the kind of impact perhaps we expected in terms of well-being of the bottom 40% or 50%, that was not visible at least. And that's why, although as a political slogan that Garib Hai Hatao came, but it didn't remain only as a political slogan. Soon enough, a slew of programs came and other developments took place. To begin with, I think we started with the development of small farmers and marginal farmers program. And again, two very important programs came around that time. I think around 1980, these two programs were launched. The first integrated rural development program that was rolled out country-wise, and the National Rural Employment Program, also NREP, started around that program, around that time. These two have continued in some form or other even today. I think in some avatar or other, IRDP was succeeded by SGSY in 1990s. Then the NRLM came in 2009 or 10. So I think some avatar of that we still continue. And the employment program, assurance program, has evolved into an employment guarantee program, and now a new law has come into it. So these two are the main pillars of rural livelihoods that was begun in late 1970s, 1980. Around that time also a bit, please remember that climate related, we don't perhaps recognize this, we can, if you reflect, you can now realize that mid-1980s, a climate related program also came to be be implemented in many parts of the country. This was called the drought prone area program, which has later evolved into a watershed development program. So I think that was, if you reflect, that was quite a happening time for all these three things. And third thing I want to stress, that perhaps it was realized that the existing institution was not capable of delivering all three. So therefore, specialized institutions also came into being. Please remember that we had the SFAL, MFL, Marginal Farmers Agency, which all were gelled into one, integrated into one agency called the District Rural Development Agency in the early 1980s. And for the DPAP also a specialized program agency was set up. For the command area development, people realize that you have irrigation, huge irrigation projects have come, but hardly any kind of irrigation water is flowing to the, equitably water is being shared. So we have this command area development agencies also came. So a lot of institutional development also took place around that time, which we haven't possibly looked at. So I think that was the time, everybody realized that we need to do something differently. That was, the earlier regime of whatever was happening, we relied more on growth. Some amount of community development action was taking place, but more focused attention to creation of rural livelihoods, for employment generation, for delivering better results. That was quite, part of built into our policy and programmatic space. So I think in that spirit, the three volumes perhaps have not looked at, not built into it, but let me emphasize that aspect of it. If we read all the three volumes together, there is in fact, if you read one volume and the other volume, also there is hardly any boundary. You don't see that one chapter, for example, if you read the chapter on the community action in Bundelkhand, look at the chapter on Bundelkhand, which is basically a collaborative efforts of 6 large NGOs to rejuvenate the traditional water bodies. So it is collaboration, so it's a form of community action and institutional development. It is climate focused, it is trying to build climate resilience. It is also building rural livelihood. So although it finds mention, it is discussed in the rural livelihoods chapter, it is actually looking into the other two spaces. So I think there is a common thread that runs through all these volumes together. Don't read these volumes as a standalone volume. There is a cross-cutting theme that runs across this thing, and they are very, very interesting studies. I think the studies that in the rural prosperity thing that I have highlighted, the ultra-poor strategy, for example, which is now, we see this section achieving extraordinary, this thing that Kerala has now come out with a very affirmative announcement that extreme poverty has been eradicated. So I think the PVTG group that is very small in size, let me also say that they're in thousands in most states. In every state, Jharkhand, Chhattisgarh and Odisha, they're in thousands. So a more focused attention to for eradication of extreme poverty among them would be a very, very doable thing. It's not a very, very highly formidable thing. So I think there are lessons to be learned, and the book certainly sort of motivates us to think more boldly about some of these actions, which otherwise, when we talk about can we eradicate poverty among PVTs, maybe 5 years back I would have thought it's very hard and say maybe I would have been very skeptical. But today maybe I can look at what has been described in different parts of the country, what kind of action is taking place. I would feel more confident of saying, okay, we can do it next 3-4 years or 5 years. Let's have a program and do it. Similarly, in the institutional development space that, very briefly that was discussed, I think two things that was emphasized by the panelists: how to build trust of the citizens. I think that is the hardest part of anything, whether governance governance requires trust of the citizens. A good governance cannot be delivered unless citizens trust you. And how do we build that trust? That is very, very important. Which are the important frontline offices citizens visit on a day-to-day basis? Are the citizens confident enough to walk into these offices? Are they confident that if I go, I'll be welcomed, I will be heard, and my voice would be, there will be some response to my issues and my problems? That is a very, very big challenge. It is not just the collector's office, which has been, there is an excellent chapter on the role of, reimagining the role of chapter in the volume of this thing. And Dr. Jain, I commend you for, I really enjoyed reading that chapter. The divergence, growing divergence between the responsibility and decline of authority, that is symptomatic everywhere. And you have also not left the diagnosis as such. You have given some very positive suggestions about how we can go towards bridging this gap. But it is not just the collector's office. What about the revenue circle office? What about a Tahsildar's office? What about a block office? What about a panchayat office? And I'm leaving out whole lot of offices. How do we reconfigure these offices for what we are aiming at in a Viksit Bharat? Can I walk into a police station confidently that I can file a FIR and I will be received with I will be treated as a dignified citizen? I'm right to live with dignity is something that somebody was mentioned. I think these are very, very important issues, and not just about rural human development, but these are human rights issues. Not only human development issues, these are human rights issues, I think, in a broader context. So I think my overall sense of what I would like to say is that the book has, how it will contribute to the policy making is a much bigger question. It is very distinct, but hopefully an attempt will be made that to take some of the key messages from this and not stop here. The India's story is a mixed story. India's story, whether it is, we look at any of the state stories, it's not something we can say, okay, we have done very badly, or we can say that we have done very well. But we have done well, but we can do much better, as most of the report cards in our school perhaps said. So we can give us that kind of an assessment. Let me only say that perhaps the rural livelihood stories, I think there are many aspects of rural livelihood stories we still haven't really unraveled. We need to look at them more closely. So many interesting stories are still need to be documented. Successes, what do you call success is also a story, and how sustainable many of our interventions are is something that question of, one can say that some of the programs look at these things. As I said, the programs which started in 1980 have somehow continued in the policy and program space over the last 40 years or so, despite successive changes of government. So there is some kind of robustness that we have developed. But we are not simply today, we shouldn't stop at that. Are we looking at India in 1947 where people should be given unskilled manual work? Is a question that we need to ask. Is that a question? We have just amended the law, and law is looking at providing unskilled manual work in 2047. I think that's a vision that needs to be discussed. How do we provide people decent work? And that's the biggest challenge today I would like to highlight. creation of livelihoods is extremely important, because nobody, today if you ask anybody, you go anywhere, the biggest problem everybody is talking about is unemployment. Whether it is unemployment, underemployment, because Professor Rajkrishna added this dimension, let me say, employment has many dimensions. It has a production dimension, it has an income dimension. He also mentioned it's a recognition dimension. You know, many times people seem to be producing something when we are earning income, but he does not recognize himself as employed, because he thinks this is not this is something I am made for something better. So I think a decent job, I mean, rural, we know that in agriculture, the challenge is how to make agriculture more remunerative, farm activities more remunerative, and more importantly, how do we take out underemployed people for better jobs in the non-farm sector. It's a very, very big challenge. The question, as Sanjay Kaul rightly mentioned, what we read in VA economics about Ragnar Nuxey or the Arthur Lewis, that problem we still are wrestling with. Creating, and I'm not just jobs, it is just decent work. Are we providing today decent work, not merely jobs which will be very where there is hardly any social protection? So I think the question of we should, in rural livelihoods, focus more on providing decent jobs and decent enterprise support to the rural families, not just in rural families, also in urban areas. And I would leave that thought with you. If there is any supplementary issues you would like to discuss, feel free to raise. We will take the issues. Thank you very much.
Thank you very much, sir. Now I invite Professor Balveer Arora. His work has been on multilateral federalism. So from the lens of multilateral federalism, how would you look at the three volumes that were discussed in the afternoon today?
Thank you very much, Mr. Amarjit Sinha. I'm grateful to you for having associated me with this remarkable release of 6 very impressive volumes, and with the ongoing work that you are doing on collaborative governance. And I think I had the privilege of listening this afternoon to the 3 volumes being presented. It's something of a challenge to theorize from the richness of the material that is before us and produce something that would be at the same time ecologically, equitably, and politically sustainable. I think there is a question of political sustainability, which is also, when we talk of federal governance, of federal democracy, and of multi-level federalism, which is what I have been talking about. I take a quote from the 3rd volume, Dr. Punia and Dr. Jain, where they stress 2 things on collaborative governance. This does not imply, I quote, an abdication of state responsibility, but a recognition that responsive governance demands coordination across levels and sectors. So that's what we are talking about, multi-level federalism. And I would share a few thoughts with you on 2 or 3 things. One is the value and virtues of polycentric government. The idea that the existence of multiple centers of decision-making and possibilities for democratic participation enriches the end product. So the values and virtues of polycentric governance. And then the second is the whole school of how do we view institutions. The new neo-institutional school, which brought back the state, which brought back state capacity and the necessity to build state capabilities to achieve developmental goals. So it takes me back a full circle because 50 years ago, wet behind the ears, my seniors, when I joined JNU, decided that I should teach public administration. That was the standard thing. When you started teaching the first course, you had to get your spurs on public administration. And at that time, the theme that was prevalent was development administration. There was political development, there was nation building, and there was development administration. And one of the things that was hammered in, which I think is still relevant, is the importance of listening. The importance of listening, which was something that was felt that under colonial rule, they didn't listen. And therefore, part of the problem was to listen to the people, to listen to their representatives, to listen for feedback. The problem was not that the colonial administrators didn't listen, but may have listened to the wrong people. So that was the issue that we had to resolve. Non-state actors is something that is cropping up in a major way in the work that is now being done on collaborative governance. And the interface of non-state actors with polycentric governance is an issue that I would like to flag because it demands a much closer scrutiny. Because voluntary sector organizations are broadly those that are active at the grassroots level, and then those who are, which are more engaged in advocacy and coordination, generally at the state capital level. So the title of the volume that I was looking at, Reimagining Institutions, the discourse of reimagining is dissecting and identifying bottlenecks, because the underlying argument is that the policies are good, but it's the institutions which are the villains of the piece which need to be reviewed. So what I would place before you as thoughts for reflection at the end of this long day where we have been treated to spoiled rather rich fare of studies covering very different dimensions and very different levels. First is the developing a knowledge of the institutional ecosystem which would permit this kind of collaborative governance to flourish. I think, therefore, reverse engineering, in a sense, we need to have a closer look and a greater understanding of the kind of institutional ecosystem which would encourage this. The second thought that I would like to place before you is that the federal idea and federal principles and their variants have something to offer in building such an institutional ecosystem. They have something to offer because of their inherent polycentric decision-making structures. And finally, the last point that I would like to develop, I don't know how much time I have, I may not be able to do justice to all this, is that multi-level federal institutions, their interface with public policy is something that could be an undercurrent in trying to understand the rich material that is being thrown up through these studies, and where we look at the ways in which the resilient as well as sustainable institutional ecosystem can be nurtured. So let me take these up briefly. Reflect on the institutional ecosystem. I think two types of federations exist in this world. And I'd start with the basics. And they throw up two institutional models. The first is the coming together type, where sovereign independent units have decided to join forces, to unite, to come together, to create something else. The second is the holding together type. India belongs to the second category of trying to hold together a very diverse territory. It wasn't even a country. It was called a geographical expression. But there are serious implications for public policy and for decision making, depending on which type of federal system you're talking about. Now, the unfortunate part is that India was always judged by the criteria that were established by the coming together federations. And by those yardsticks, India fell short on many counts. It was the first major holding together federation of the 20th century. The first post-colonial and the largest, and to that extent, the ways in which the system has to be visualized, constructed, and operationalized differ greatly, and I think this is an area which is under-theorized because we need to put together our thoughts on what we can contribute to the understanding of diverse holding together federal systems. The centralization-decentralization axis is a different thing. In space, in time, we can analyze those. It's not identical to federal and unitary. It's a separate issue which overlaps and which can be understood. The second idea that I am placing before you is that looking for the levers of centralization and decentralization in a federal system. This is something that would lead to a better understanding of collaborative governance, and as an important part of the toolkit of collaborative governance, I think we could look at separating the functional from the dysfunctional and trying to have a better comprehension of what works and what doesn't from the point of view of the overall vision of the institutional ecosystem that I mentioned. Finally, and I must conclude, I see a primary tension between institutions of self-government and institutions of state governance. this is something that comes across, and I'm glad the reference was made to the changing role of the district collector. I think this tension between the institutions of state governance and the institutions of self-government needs to be frontally addressed because some of the studies that I have glanced through tend to confirm that those efforts at bringing about change, which are based on solid support from institutions of self-government, have a longer chance of durability and of sustainability. So, which is why I think it's important to consider this. And I will conclude with just mentioning one other factor, which is leadership. Leadership in multi-level federal systems is a challenge, but it's also the centrality of leadership in collaborative governance and leadership alliances, again, keeping in mind the importance of democratic self-government institutions. Thank you very much.
The time for the session is over. In case there's any question or comment that anybody would like to make at this time. Thank you. Thank you so much. Thank you.
Thank you to our distinguished panelists for their thoughtful reflections and views on the interconnections across the sectors represented in these 3 volumes. I would like to invite Dr. Arushi Jain to kindly present the mementos to our panelists as a token of our gratitude. Can we have a huge round of applause for our distinguished panel? I request the panelists to please take their seats on the stage as we proceed towards the official launch of these 3 volumes. Before we move to the launch ceremony, I invite Professor Anjal Prakash on the dais to deliver the closing address for the discussions held in the second half of today's program.
Thanks, Nimisha, and I'm not going to bore you with the summary of what the sessions were all about, but I'm just going to thank you profoundly for a wonderful session that we had since morning, especially in the afternoon also. We had 3 sessions, and all the sessions, as you know, has been very enriching for all of us. These are the volumes that I think is a must to read for people of public policy, researchers and development workers who are interested in looking at the new changes which has been brought about. And I want to thank each one of the editors first, all the authors, which is about, around 200 authors, and what we call the researchers from BIPP. All of them have really put in hard work for almost 2 years, and we know, Amarjit Sinha, how much has been a pleasure to work with you. Sometime pain in the right place, because he has been the one who's pushing behind, for all the volumes to come. But it's a very well crafted work. Amarjit, a special round of applause for him, please. Very good. Thank you. With this, I was actually, somebody was telling me that, Amarjit, your energy is actually unmatchable and something that is moving us. So we, almost people who have been really looking up to him and for all of us. So thank you so much for each one of you for your time today and also putting the energy which is required to produce this volume. Thank you once again from ISP. Thank you.
Thank you, Professor Anjal. Ladies and gentlemen, now we come to a yet another defining moment of today's program, the official launch of the final 3 volumes of the Micro Studies in Human Development series deliberated upon this second half. These volumes focus on rural livelihoods, climate action and justice, and institutional pathways to social development, themes that lie at the heart of India's development journey and speak directly to questions of sustainability, equity, and governance. For the launch ceremony, I would like to invite the editors of the 3 volumes on the stage, please. I would also like to invite the series editors. Can we have a huge round of applause for this milestone celebration today? A huge congratulations to the entire editors, authors, and the research team behind this huge work. Thank you, everyone. Ladies and gentlemen, before we officially conclude today's program, I would like to invite Dr. Arushi Jain for an official vote of thanks.
Thank you, Nimisha. I think we are already over, and thank you so much, everyone present here, for your presence, for the insightful discussions, to all the panelists who've spoken in the second half, but also through the day. I think it has been a day of a lot of enriching discussions, a lot that we will be taking back together, and we will be reflecting and contributing in our different spheres. Thank you, one and all. Thanks.